Good. This group has not gathered in 4.5 years. And you may be a bit surprised that I was standing up here 4.5 years ago speaking. And for those of you who were there then, I'm sure you just remember everything I had to say, so I won't repeat what I had to say back then. But a lot of the message is the same. And we're just thrilled to welcome all of you here today. I'm Rob Fersh, and I am the person who started this organization. Where's Akif? With Akif Ahmad, who came in and became co-founder and CEO and helped build this, COO and helped build this organization. There are so many other people in the room here who have been instrumental in our success. So I want to warmly welcome everybody. We have something like 30 first-time guests, and we want you to feel welcome. We hope you have a great day. We hope you'll be inspired to become part of our larger family. These meetings are so meaningful to us, to bring together people who are such a source of support for us over the years. And we'll talk to you more about that, what that means to be involved with Convergence. And people help us in so many different ways, whether it's hosting events or suggesting projects or contributing money or connecting us to people who can help us do our work. And so we really want to make everyone feel welcome, especially the first timers. And I also want to especially acknowledge, and there's too many people for me to cite, the people who've been with us 10, 15 years and keep coming back. It's such a balm for the staff to know that there are people around the country, and you're coming in from about a dozen states, who support our work in so many different ways. And we hope that in turn that you have a rewarding and good experience working with us and spending time with us today. So yeah, I'm Rob Fersh. I usually introduce myself as I used to be Rob Fersh, because I'm now semi-retired, and you'll learn more about what I've been doing to keep myself busy working so closely with Mariah on our book and helping Convergence in any way possible. Well, remarkably, Convergence turned 15 just a couple of weeks ago. And, it's not always been an easy ride. We started very humbly. Akif can regale you about our staff meetings at a local McDonald's when we had no space. We've had a lot of growth since then, and I want to just tell you how excited I am about the upward trajectory of the organization right now. And at the moment, my main reason for being here is to introduce Mariah Levison, our terrific new leader of the organization. But I wanted to at least a couple other points before we get to that. And that would be simply to acknowledge that we've been through a tough time over the last year. We went through a transition which challenged the organization both spiritually and financially, and we've come out strong on the other side. And there's so many people in this room who've been part of helping make that happen. I want to cite in particular Gene Molino. Where's Gene? Gene, I want to cite, where's Art Taylor? Is Art back? Art Taylor, our new board chair. And of course Mariah for the work she's done with the team to rebuild the organization. I'm just going to take the liberty of saying to all the staff members here, you will not know the level of effort and commitment of this group since our, what I would call emergency struck last September. People working long hours to make sure this organization and its vision got back on track and moved forward. So let me acknowledge the extraordinary work of the Convergence staff, whom you'll get to know. And the reason I'm up here is that none of them were around except for Doozy. Of course, Doozy is a stalwart. I meant to mention Doozy is the other person who has just been with us 14 years and indispensably help us. Standing in the back is our Executive Vice President, Beth Miller. You'll get to know her better. And a member of the senior team is Kit Chalberg. Where's Kit? It's there. Kit runs our learning lab. We get to meet him. Anyway, just an extraordinary effort to make this organization go. So that's pretty much all I want to say before introducing Mariah. Just how good it is to have you here, how important it is to us to have your love and support and your intellect help us achieve our mission, and how valuable it is to have people involved and working with us on the very ambitious mission that we have. It's a very idealistic vision, but it's grounded in the reality of our experience. You're going to hear a lot more about that. You'll hear from participants today. You'll also hear from the president of NACO today, who's here with us and doing a wonderful initiative with us. So let me conclude by simply introducing Mariah. I've got notes here, Mariah. I'm just going to spend it on Mariah. Mariah came to us, almost 2 years ago, about 2 years ago, as our Chief Program Officer. And when our emergency hit last September, she took on a job she did not apply for and didn't even desire. And she did a remarkable job over a 6-month period, rebuilding the organization, building trust with the staff, building trust with the board, and then just a couple of months ago agreed to be our long-term leader. She's a gifted leader. She has high intelligence, emotional intelligence, academic intelligence. She's a student of the field. Her passion is to do this work. And she's a wonderful human being and a dear friend besides. So let me introduce Mariah Levison, our new leader, our gifted leader, and someone who will help this organization rise to its fullest potential. Mariah?
Good afternoon, everyone. So glad to be here with all of you in person. Even though I run a virtual organization now, I'm a person who really likes to be in person, but I live all the way in Minnesota, and I'm lucky to have a couple of my Minnesota colleagues with me here today, but miss getting to be in person with lots of you, so glad to have you here today. Thank you, Rob, for that generous introduction, and especially for your friendship and partnership in advancing the work that's so important to both of us. I met Rob when I ran something called the Minnesota State Office for Collaboration and Dispute Resolution, which does very similar work to Convergence at a state level. And Rob and I were both so pleased to find a kindred spirit who is so dedicated to doing really similar work. So it's been such an important relationship for both of us, and we're going to be excited later today to share more about the book that we have written together. So if you want to test your friendship with someone, write a book with them. It's very easy to write a book, especially if you hire an editor who can help you a lot. I want to also start by I said thank you to everyone for being here. Rob named some of our longtime champions and supporters, and particularly want to thank those of you who are new to us today. We're really excited to make new friends and grow our community of champions. For those of you who are new, I'm going to give just a very brief background on Convergence so that you have some context for the deeper dive that we're going to do today into some of our work. So in case there are some of you in the room who aren't as familiar, Convergence was founded about 15 years ago, as Rob said, to bring together leaders and doers across ideological, political, and cultural lines to build relationships and develop higher ground, consensus solutions, and unlikely alliances for constructive change on seemingly intractable issues. And I think the thing that I love the most about our work is that when it works well, the solutions that we develop really include a uniquely diverse set of needs that are met by them, and then therefore championed by a really uniquely diverse set of stakeholders, which can really lead to wiser and more durable solutions. So that is our main work, and we accomplish it through what we call our Convergence Collaboratives, of which you're going to hear a lot about today, and our Learning Lab that Rob mentioned, which is our program for sharing the methodology that we've had so much success with others so that they can apply it in their institutions and communities, enabling us to scale some of this work at a time when it feels very needed. So as Rob shared, I did not seek the position of being the CEO. I am really a mediator at heart, and I'm this rare person who's really happy in a really divided room of people where I can help build trust and build consensus solutions. So I hope all of you will give me a lot of trouble today and give me a chance to use those good mediation skills. But nonetheless, I am honored and humbled and excited to take responsibility for advancing this really important work with all of you. And I certainly don't do that alone. I love this work because I am really collaborative, and it's one thing that I love about leading Convergence is it is a collaborative endeavor. So I want to thank all of our board members for your support of me and for the dedication that you exhibit to this organization. So board members, if you would please stand. So we have Allison Winters, Art Taylor, our current board chair, Stuart Butler, a very long-serving board member who you'll hear from today, Jeff Weisglass, Jean Molino, our longtime chair, and Leah Ray, as well as Rob continues to be a board member. So thank you to our board members. Our board members do so much to make our work possible. And so do so many other volunteers and donors, including our Leadership Council members in this room and our many loyal and new friends who advise us, who support us, who make connections for us, who support us financially, and more. So before we jump into some of our programming, I want to share a few updates with all of you about what we've been up to since our last Leadership Council meeting in person, which, as Rob said, was 4 years ago. And I will warn all of you, I came to a Leadership Council meeting in person maybe 6, 8 years ago, and now I'm the CEO, so be careful, you too. But since we have last been together in person, we have brought together diverse stakeholders to help them build trust and forge consensus solutions on healthcare affordability in California, on reimagining care for older adults around the things that happened in the pandemic, around guns and suicide prevention, around civil service modernization, digital discourse, pathways to better jobs, and more. We also started a new partnership with an organization called Starts With Us, whose mission is a lot about elevating this kind of work and sharing stories. So we work with them to bring together citizen stakeholders on really divisive issues at the state level. So far we've done work around guns in Tennessee, around abortion and women's health care in Wisconsin, and they have made a feature-length documentary, which I unfortunately am in, that will be coming to, I don't know where, near you. We will let you know, but their mission is a lot about telling the stories about America's hidden common ground. We also, as we have mentioned, launched our Learning Lab, which we feel will really enable us to scale our impact as never before and meet the increasing demand for evidence-based approaches like ours for overcoming our division. So today you'll hear a deep dive into a number of our collaboratives. The first one has the moniker Democracy 250. It's an ambitious project led by Monica Omanmak. I don't think I know how to pronounce your last name.
That's okay. We can move on.
What is it?
Blavatsky.
Blavatsky. I work very closely with Monica, so really I do. But Monica's leading a very ambitious project to build consensus on and momentum for passage of democracy-strengthening legislation to commemorate the 250th anniversary of our nation. That project is in the initial discovery and design phase, where we're doing a lot of exploration, and we're going to engage you in that exploration later today. We're also going to hear more about our Social Factors of Health project, which is led by board member Stuart Butler, and we have some wonderful panelists here today who are part of that project. That project is focused on building consensus around a set of policy changes that would enable greater implementation of the now broad agreement that social factors play a significant role in individual and public health. The project includes participants and observers who are public and private sector leaders and are well positioned to take action on the solutions that the group is developing. And finally, we'll hear from a collaborative that just concluded its consensus building phase, our Supports for Working Families project, and we have participants from that collaborative with us here today. We're so grateful to have all of our participants here to help us explain and demonstrate our work. And they'll talk about the solutions that they developed to help young families in America thrive, and you'll hear from them about thriving, which was a theme of their work that gained a lot of traction, and they'll share about kind of the robust attention that their work has gotten and the work that they're doing to ensure that it gets ongoing traction at the national, state, and local levels. Something that we won't talk about too much today are the collaboratives that we have under development, but those include collaboratives on economic integration of immigrants, housing affordability, and climate change. And I'd like to take a moment to thank Mark Zitter and Rick Callahan, who have both helped us to get Mark on climate change and Rick on housing affordability, those projects off the ground. And if others have ideas to help us have more ideas and insights and full funding for those projects, we would welcome them. And now we have a special treat to highlight one element of our work, and that is that we're thrilled to be partnering with the National Association of Counties, that's NACO, you heard Rob mention, to support county leaders to build their capacities to address the tensions of a polarized society, to bridge divides, and to collaboratively solve problems in their counties. I did a bunch of this work back in my old gig, and I'm really passionate about the role of local government leaders to help do collaborative problem solving in their communities. They're just at that right level of the community, whereas elected officials, they have that position in the community, but also at the county level or city or other units of local government are so close to their communities, and they're charged with bringing folks together to solve problems. So we're so excited to be partnering with NACO to provide these skills through a toolkit, trainings, articles, and a whole bunch of work that Kit Chalberg is leading. So this partnership is in partnership with NACO's current president, Mary Jo McGuire, and is part of her Forward Together initiative. And I could not be more thrilled to be partnering with my very good friend, kindred spirit, and fellow Minnesotan, because Minnesotans really are nicer. If you're not familiar with that phrase, come chat with Mary Jo or I, or where is Breland? Breland is also a Minnesotan. On this partnership, which Mary Jo and I started working on together back at the Association of Minnesota Counties in Minnesota. So Mary Jo is going to come up and tell us a little bit about Forward Together, her vision for building counties' capacity to work well together across difference, and how the partnership with Convergence supports it. Welcome up, Mary Jo.
Wow, thank you so much, Mariah. It is just so exciting to be here. I said it's great to be in a room where I don't know hardly anyone, because there's all these amazing people doing all this amazing work that I don't even know. So thank you all for this, and thank you, Mariah, for your leadership and for your introduction, and Rob and Kit. The three that I know from Convergence have all just been such great partners already. So I am Mary Jo McGuire. I'm a county commissioner and was lucky to be elected president of our National Association 4 years ago. It was about the time that Mariah and I were working together at our State Association of Counties, which I was president of as well, and she did groundbreaking work for our counties at the Office of Collaboration and Dispute Resolution. You know, counties really are the level of government that has to get the work done. We can't let any of our value divisions and our partisan divisions get in the way, because someone's got to get that work done, and it's us. And so she did groundbreaking work in helping us cross our differences and really, move forward on getting work done. So I was well acquainted with how transformational that work can be. So when I became president of our National Association, you get to pick a theme. And I was like, oh, wow. Well, I said to our executive director, what's the most important thing I could do? We do Thrive, and there's mental health, transportation. Counties do everything, of course. And I said, what would be the most helpful? He goes, well, we are a divided country. He says, it would just be good if we could just hold our association together. Like, just hold us so that we can move forward. I said, okay, that's what I'm gonna do. I'm gonna move forward together. Like, we gotta do this together. So we have, 3,069 counties. They're on the political gamut for sure, conservative to very liberal, and size, and in geography, and in issues. But we all come together at NACO on issues that we care about. And it's amazing that we actually have a platform, a whole booklet of things we do agree on. But we have a population that we serve, and legislators that we try to work with that are different. And so when I wanted to move forward together, I said to NACO, I said, I've got this good friend, Mariah, and she's doing now great work at Convergence, because you had moved on to Convergence then, and I said, let's talk. So that was one of my first conversations was with Mariah, to form this partnership with Convergence to help us develop a toolkit, which Kit is working on, so that counties can have difficult conversations with their residents, with each other. County boards are not all aligned necessarily, with our state legislative partners, with our federal partners, and we are just learning how to have these conversations and working on this way. We are so grateful for this. I have a background at the legislature. I spent 16 years there, so I know how divisive those partisan groups can be. And they want to get work done, but it just gets in the way. But the county level, we have to get the work done. So I'm so excited about this. We have a meeting in 3 weeks. We're gonna launch our toolkit to counties. We had a workshop a few weeks ago at our legislative conference in DC here, and we had standing room only. 100 people came to a workshop to learn about collaborative problem solving. I mean, this is how hungry county board members are in this work. And Kit, of course, did a great job, explaining how we could have this work happen. So I am super excited, as you can tell. My theme of Forward Together, it has three legs to the stool: connect, inspire, and lead. Connect and build bridges, which is totally with the work that we're doing here. Lead on, can inspire engagement. So much of the work that NACO does is about inspiring people to be involved in our work. We actually have some great tools for this. We're launching our My County, well, this is already there, but we keep revising My County Works so that people understand, all the work that we do and how we do it together. And then we just now have the Marvelous Adventures of County Land, which is an AI-produced Dr. Seuss, in the words of Dr. Seuss, how counties work and what they do. Because so much of how this work gets done is to understand each other and to understand government. And I'm sitting, we got a great table with people who are interested in our democracy. And of course, who does elections but counties? So we do them well, and we know we do them right. And we have lots of people challenging that, but we are the ones that care, about this democracy working. And so I am super excited to keep promoting this. When I'm done with being president in July, I'm going to be the czar of civic education, building bridges and coming together. So Zarina, I should say, yeah. And we're just going to keep working on that. So I'm just so grateful to be invited to this. I'm going to learn with all of you. I could go on, and I'm not going to. I have little bracelets that I ran on when I ran called Leading Together. And now we're moving forward together. Actually, I inspire engagement, and then I miss my leading on intergovernmental relationships. We are only as good as our partnerships with our federal and state partners, and that's so crucial to all the work that we do. So those are my Connect, Inspire, and Lead. Forward Together. My incoming president after me, James Gore from California, is very interested in this work as well. So I know that it will continue under his leadership. The counties are anxious and excited to work with you, and just thank you so much for all your work, and I'm so grateful.
Even though we are all up here on a podium, we mean this to be an informal gathering, and so we encourage people to keep getting coffee and food and just relax and chat, and there's other rooms around here. So before we dive into our next bit of program, we just want to open it up for a couple of minutes. Questions, reflections. We got a lot of requests to come back together as a community. We really heard that loud and clear, so if anyone wants to share about what this community means to you, why you go to the trouble to come to these events. We know many of you traveled to be here. Just want to open it up for a couple minutes. Questions can be for Rob, for me, for Mary Jo, reflections, anything really. I know you guys are not a quiet crowd, Sean.
Right.
Sure, we get to hear from our keynote early.
There you go. Very grateful for the opening remarks. I have a question for Mary. I agree with something Mariah said, which is that local elected leaders are in a prime position to buck the polarizing trends of the larger political culture. Because on the one hand, you have responsibility of leadership, but also enough proximity to the people you're actually serving to actually be able to develop humanizing relationships with them across ideological divides. But what I have been told by at least some leaders of the county and municipal level is that while historically partisan culture war sort of politics has not been so prominent on the local level as it is on other levels of politics and government, that in recent years and months that is starting to change in certain places. And so I'm wondering what that trajectory looks like from your vantage point on the county level.
Absolutely. Such good observations and unfortunately accurate observations, because they're trying to draw us into this. So we have lots of legislators that are asking county boards to take positions on things that aren't really in our lane because they just want to have help with their divisions. You know, they want to have support in their divisive viewpoints. And we're like, no, we're county boards around the country are taking resolutions like, we are not going to pass resolutions that are not in our lane. So we don't get drawn into that, but they're definitely trying to do that. And yes, in elections, we see unfortunately, in many states, you know, you're still elected on a partisan ballot. Unfortunately, in Minnesota, we are not elected on a partisan ballot.
I told you we were nicer.
Yeah, we don't have a label by our name when we run for ours, so people don't really necessarily know. Now, I will say that people want to know more on both sides. You know, we want to know where you're leaning on these things. So we are, it's really the purpose of my initiative because we are seeing that we are being asked to be drawn more into this divisiveness. And it is happening more often. We have county boards that have been taken over by people that don't believe in government, they don't want it to work. We have, I just heard today, 3 more election directors left their positions because it's too hard to run elections which they know are right and still be criticized, be challenged, and to just not get to do their work. So we are in a crisis. It's why this work is so important, because as in the past, local units were traditionally left out of a lot of that. They're going to great lengths to bring us in, and there's a lot of effort. I mean, there's a lot of organizations that are putting a lot of money into local races. On both sides, I would say, for me, the biggest danger is on the one side. I mean, we're like, oh my gosh, we have to counter that. So I would just say it's a great question. We are seeing it. We're doing our best to just bridge those divides. I was encouraged when a guy from Montana's very different than Minnesota and very different politically than I am, and they said, you know, you've been really good for our members, because I don't think they ever thought they could actually talk to someone like you. You know, someone you know, who's from a metro area, perceivably a little bit liberal. You know, I ran on no party label when I ran for NACO, and I wear red usually, so people were very thrown off. And so, but they said, we are glad that we can have conversations. Anyway, we're just starting wherever we can. We're doing as much work as we can. So we're faced with it though, so it's something we just gotta all keep working on. And county government, we know it works better when we don't get involved in the fray of the divisiveness.
Some of you may be aware that the National Governors Association has a Disagree Better campaign. I do think these associations play a big role in helping their members stay, you know, in ways that they can work together well, and NACO is certainly doing that, so we're grateful to be a part of it.
Thank you for that, yeah.
Other questions or reflections? Yeah, Mark.
Thank you. Thanks for the opening remarks. Mariah, I think I can speak for everybody here that we're here not only to learn, but to be helpful. So this group leadership council, how can we be most helpful to members?
Well, starting in just a little bit, we're going to have some discussions around the room asking for your input on ideas. So those are some of the ways. I think historically our leadership council has brought us ideas of projects we can work on, has helped connect us to people who would be influential in projects that we are working on. Most of our projects are a grass tops model. So our model is about getting the full range of perspective into the room and also the full range of influence, so that then folks are able to move their solutions forward. So connecting us to people who would be good fits for our projects. Taking our calls, you know, we reach out to lots of you at lots of different times about, you know, would this framing of our project work well? What do you think about this? And just, you know, being champions out there in the world, sharing the message. Unfortunately, it feels like today, like every word is becoming like not okay to say right. Not, you know, compromise certainly is a word that has gotten a bad rep. So now even consensus is, so now we talk about higher ground solutions. But being out there talking about this kind of work and why it matters. So I think there are lots and lots of ways, and we're really excited to be in conversation with you about them today. Anybody else have thoughts, answer to that question? Staff or others who have been a part of the Leadership Council? Yeah, Rachel.
Would you say no to donations?
We would never say no to donations. Thank you, Rachel. That is always a great way to support us. Other questions or reflections? We have time for maybe one more.
I heard there's a clamoring for collaborative problem solving, skills building, and I'm curious if we know of any efforts that are happening like that.
To, over the years, helping them have more relationship building off the record, figuring out ways to work together, and some of that involves some capacity building. And there's a number of foundations, perhaps Hewlett Foundation chief among them. So lots of folks are thinking about that. I think sometimes people think like they're the seat of power, why would we put more resources towards them maybe, but there's clearly a need. And I will say, from my experience working on the state level, which is different than the federal level, but I ran something called the Bipartisan and then the Civility Caucus at the state of Minnesota for many, many years, and we would hold events about once a month, and we would get sometimes 2/3 of the legislature. Many of them were very partisan, but they would come and say, this does not feel good, we don't like this, I don't even know why I serve in office, because I come here and it's all divided and a few senior leaders make all of the decisions. So my personal experience is that nobody wants it to be that way, but there's not enough, there's so many headwinds pushing things the way they are, and that we need more things that support people in being in the ways that I think they mostly really do want to be. So with that, we'll transition to our next part of the program, our Supports for Working Families project, which we're so excited to share with you.
Hi, everybody. My name is Beth Miller. I'm the Executive Vice President of Convergence. Thank you, Rob, Mariah, Mary Jo, and all of you for being here. We're so excited to have everyone. So before we get started with the Families panel, we're going to show a quick video. You'll hear from our project director and some of our panelists, and then we'll get started. Mariah's going to moderate the panel with 3 of our participants from the Families Project, and then we'll open it up to you guys to ask questions. So thank you.
Hello, my name is Abby McCloskey. I'm the mother of 3 young children, a researcher, and I believe that our country has a moral imperative to better support the children and families who live here. And that's why I was delighted to direct the Convergence Collaborative on Supports for Working Families. We brought together 32 leaders in family policy from across the political spectrum to develop an action agenda to support low to moderate income families with young children. We came together with specific recommendations for government, philanthropy, communities, and employers to better support parents with newborns, to create more care options for young children inside the home and outside of it, to rethink how we provide cash support to families with young children in this country, and to change the story about early childhood and parenthood in America to build a broader coalition of support for this critical group. Here's what our members had to say.
This opportunity allowed me a chance to get to know people who had different views, but were respectful and understanding and tried to learn my views just as I did theirs.
We're excited about the work of Convergence and so grateful to play a role, specifically around the areas of childcare and the recommendations there. We see some practical ways to move forward, not just at the national level, but also at the community and the state level.
It was really cool to see a really diverse group of ideologically diverse backgrounds to come together around this really important issue.
I especially appreciated kicking off our first meeting by discussing what we believe it means for families to flourish, and realizing that we almost universally share the same ideals, even if our views on how to get there differ.
Through this initiative, I saw a diverse group of leaders come together with the shared belief that when children and families have a strong start in life, we all win.
It was really important to figure out where folks are coming from and where they might see red lines or opportunities for future reforms.
I valued all the opinions, the thoughts, the experiences that came through this group. It really validated the way that I felt about families and children in a way that things need to change in this country so that children and family can thrive. So it was just great to be with a group of like-minded people with their own opinions on how we should do things. And I hope that we can make big changes from this group.
Thank you for watching, and if you're interested in learning more about our recommendations, a link to our report can be found below. Thanks.
So we,
I think you can press the button. Press it hard and it goes green.
yeah. So we are so grateful today to have 3 of the participants from our Supports for Working Families Collaborative here with us today. They're taking time out of their very busy lives and important work to be with us, and we are so grateful to have you all be able to hear directly from them about the work that they did. So I could go on and on about how wonderful each of these women are and how lucky we are to work with them, but I will leave it for now at their illustrious titles, and I'm sure that they will share more about themselves during our discussion. So we have with us Elizabeth Jacobs, who is a senior fellow at the Urban Institute, Aparna Mathur, who is the senior manager of economics at Amazon and former senior fellow at the Harvard Kennedy School, and Catherine Stevens, who is the founder and CEO of the Center on Child and Family Policy. So in this first round, we're gonna go down the line and ask each of you to share what was most valuable or surprising about participating in the collaborative, and what about this effort made it different from other efforts that I know all of you have been a part of. And no trick questions there, because they have all answered this question on a panel for us before. So, Elizabeth.
Thanks, Mariah. This, I think, is a good, okay. So a couple things. One, we started as a group with values. We spent almost an entire day, one of our first sessions, really hashing out what are we trying to accomplish? What are the shared values? How do we really define it? And so we ended up focusing on family flourishing, which is, it's a new word. I had questions kind of all the way through our editorial process of like, how do we end up with this word exactly? And I think it was actually quite intentional. I kept on wondering whether it meant something to some other community that was around the table that I was like missing, but I don't think that the answer was ultimately yes. I think it really was, it was just the right word to encapsulate what it is that we'd collectively decided we were aiming for. And that shouldn't be an unusual place to start, but I think it's a hallmark of the convergence approach of really saying like, what are we all trying to do here? Like, let's agree on what we're trying to do, what we're trying to accomplish in the world and for whom. And the fact that we spent so much time really getting to the bottom of that, I think was hugely important. The second piece, which I think, we've already heard and I'm sure we'll hear over and over again, for me was really being in a room, not just with different ideological perspectives, but different perspectives in terms of institutional place, in terms of location, in terms of where in the ecosystem people sit. So I'm a think tank person, I'm a researcher, I know the research to action kind of continuum of work really well, and I've done that in DC my entire career. But to be able to be in a space that intentionally brought folks like me, folks like some of the people you saw in the video who are directly working, for example, running childcare agencies, doing really local granular work, to create a table that had space for that in addition to the ideological dimension was really fantastic, and just doesn't happen often enough. So I'd say those two things, one kind of substance and one operational, to me were part of what made this work really special.
Thanks, Mariah, and thank you for hosting this. So as Mariah said, a lot of us have been involved in other efforts. I was actually struck a lot by what Mary Jo said earlier, and that's kind of where we started the work originally, which is we see a lot of political divide in DC. Democrats want one thing, Republicans want one thing. And about 10 years ago, when I was at the American Enterprise Institute, we said, on one particular policy on paid leave, can we get agreement? Because there's a huge difference in how people think about it. But like Elizabeth said, there's certain principles that we all agree upon, which is that families should not be struggling, parents need help, children need help. If you provide support at the right time, how do we can actually change people's lives? And agreeing on those principles was why we started the AEI Brookings Paid Family and Medical Leave Working Group, which went on to, Elizabeth was a part of that, and many other people in the Convergence Collaborative were part of that. And what I loved about that was really trying to get at, yes, there are political divides. We have people who come in from very different perspectives. They've supported Republican administrations, they've supported, Democrats. but at the core of it, there's an agreement about certain values. And to me, that was very similar to the work we did with Mariah and team, is coming together and saying, what does flourishing mean? And what I loved about the work was also the broad scope of it, right? It's not one policy. We're trying to understand what family flourishing means, and we spent a ton of time sort of defining, well, what is a family? What is a young child? What is the age? Who are we targeting? And what does it mean to thrive in America today, right? It's not just about one policy. It's not paid leave. It's not childcare. It's this whole host of things that have to come together for families to feel like they are, they're surviving and they're doing well and they're flourishing in the US. So what I loved about the group, I think, was one, the expanded scope of how we think about, what does it mean for families to do well? And secondly, the diversity of perspectives, because that's the only way we can move forward, if we allow people to say what they think and what they feel and still be able to listen to each other. Was, I think, the second biggest thing. We were 32 people, and I remember even with the AEI group, we were, 10, and there was just, such a range of options and such a range of voices. So having 32 people in the room and still be able to listen to each other, and, surprisingly, Mariah put out a report that had concrete, substantive proposals, to me was the biggest surprise and a really pleasant surprise, because I remember how much work we had to do to even put out one report, to get people to say, okay, here's a, consensus plan on what we can agree to. So what I love is, there's a bunch of people who are willing to compromise, but for the greater good, and I think the collaborative achieves that.
Well, thank you very much for inviting me to this. I'm delighted to be have a chance to talk to you guys. So 3 things I would say really stood out to me about this this group from anything I've participated in, and I think as far as I know, unique to Convergence and essential. The first is, of course, it's becoming increasingly unusual to be brought together with people who don't think pretty much like you and adjacent you, or you adjacent, I guess is the thing. So just that in and of itself is something that I don't know, in the good old days, we could maybe take for granted, but that's not true anymore. And we increasingly, I would say, actually desperately need efforts that are deliberately bringing people together who are otherwise unlikely to be talking to each other at all. So that's thing 1. Thing 2 is humans are hardwired to interact in 3 dimensions, like humans to humans. If I were a video right now, I assume that brain scientists have studied this. If not, they should be. That whatever is going on in your brain, like the electrical impulses, are different when I'm physically in 3 dimensions in front of you. And I think we all, Zoom is amazing. We can participate in all kinds of meetings and interact with all kinds of people that we wouldn't have been able to before. But we forget that humans are really hardwired for in-person 3-dimensional interaction. It's not efficient. People have to travel, even if it's just going across town. You have to put pants on. That is always a challenge. So I would say, so thing 1 is bringing people who are not you adjacent, but actually you opposed. Thing 1, thing 2 in 3 dimensions. And then 3 is in a process that is deliberate and supported, and frankly time-consuming. There just are not shortcuts for this. So it's not enough to, obviously, if we just had a Zoom call, let's say, with people who already think like us, that's like here. Then we could have a Zoom call with some people who are theoretically, we're bridging differences, that's here. And we just like ignore them if we want to. There they are in a little square, like who cares, right? Then we could actually go that next step and bring people together in person across differences. But that is not going to work either. Maybe in the olden days, again, it worked. One of the things that was just phenomenal about Convergence was the facilitation of this. It's a very deliberate process that they've developed that enables these other two conditions, people across differences, people in 3 dimensions, to actually get somewhere. And that is something that I haven't seen or participated in anywhere else.
Should have left it on. Thank you, Catherine, Aparna, and Elizabeth. You all did as good a job as I could have elevating what is unique about Convergence. I think that piece about the vision and the thriving is a real hallmark of Convergence projects. It's something that I've done this work my whole career, but something that is new to me is, in every project that we work on, we're hearing this theme about sort of a brokenness in society, around trauma, around how tough things are, whether that's about digital discourse or guns or healthcare. We're hearing that everywhere, and I don't know if that's because things are tougher or because we have a language around it or what it is, but that piece of coming together on things are too tough and let's develop a shared vision first. So rather than going right at how much should that child tax credit be, how many days of paid leave, saying, wow, this is something we can all buy into. So doing that piece first is a real hallmark of Convergence's work. And it really helps people remember that we really do have shared values. We all sort of know that, like we sit here and say, of course we do. But we think about some issue that's close to our heart, we think, yeah, but not those people over there. Those people, they're just crazy, they're up to no good. When we go through that kind of process, we really remember the shared values that we have, and then that gives us the foundation to negotiate the very real differences that you all still had around how do we then implement that vision. So once we remember that, we can work through those pieces. So thank you for illustrating that so beautifully. So a question for you, Catherine. Catherine has a really interesting background growing up in a family that had one sort of viewpoint, working for an institution that had another one, and really traversing all of these different points of view. So Catherine, if you want to share a little bit about that personally, you're certainly welcome to. And also from a policy standpoint, what do you think are the perspectives on the right around supports for working families that are too quickly dismissed in bipartisan conversations?
Thank you for that question. So yes, I grew up in what, in retrospect, I realize was a very left-wing background, very left-wing environment. I was not politically oriented. I wasn't ideologically oriented, really. It was more like that's the water in the air. And then through a whole series of things, I ended up in 2014 getting a position as a research scholar at the American Enterprise Institute here in DC, focusing on early childhood. And I came to realize that although, to be perfectly frank, I had known that Republicans were horrible people my whole life, I had never actually had a conversation with them. So once I did have a conversation with them, I realized that my ignorance and kind of provincialness was kind of off the chart. So that in and of itself was a very valuable experience. And as Mariah said, that's kind of put me in this sort of position of my family history kind of positions me to think about what the left says. But then I was at the American Enterprise Institute for over 6 years, and then founded my own organization, the Center on Child and Family Policy, which is known as we're known as sort of more conservative. But one of the reasons that we're known as conservative, which really actually does not make sense to me, which was a focus of our group and had a very positive outcome, I think. And that is, on the left, when we talk about child, or just in general in our society, when we talk about child care, we generally mean paid non-parental group care. And in fact, young children, say under age 5, for any young child, their family is by far the most essential early learning environment that they have. And a majority of especially lower and middle income parents would much prefer to be home with their own children rather than placing them in the care of paid strangers. That perspective, the perspective that what we called in the report a holistic child care agenda, a holistic child care agenda includes parents. That parents are the fundamental kind of pillar of America's, quote, child care system, and that to exclude them does not make sense. This is a conversation that is kind of oil and water, and one of the things that I was most excited about in this group was that we were able to encompass both the very serious need that many families, especially lower income families, have for affordable, high quality childcare where they will feel okay leaving their child there without losing sight of the fact that parents are by far the most important child caregivers in a child's life.
Thank you, Catherine. Aparna, you also have a very interesting background working in interesting companies and institutions, and I know that you have worked on paid leave reforms for a while. So I'm wondering if you could talk a little bit about paid leave and where the current status of the conversation is and where you think it's going.
Yeah, thank you, Mariah. So as I said, when we started the work around paid leave, this was part of the AI bookings working group. And at that time, the biggest discussion was, look, the U.S. is one of the few countries that doesn't have a paid leave policy on the books, and unfortunately, we're still there today. But what we did as part of the group was to provide a lot more data and evidence to try to understand, where are the biggest gaps in care. We started the work around looking not just at paid parental, but paid family and medical leave. And pulling in data sources to understand across states, across the private sector, across the public sector, where is the biggest need. And it was really interesting to me that in the first year, we had started off with this really ambitious agenda to look at all 3 policies together, and very quickly realized that, even gaining consensus or even coming up with a compromise solution or a compromise approach on one of these was going to be really hard. And the reason is that people think about these policies actually very differently, right? Paid parental leave, like Catherine said, people associate with, yes, it's about looking after children, it's about new parents, how do we provide them supports in the workplace. The reality is that for the majority of parents now, with young children, they're in the workforce, and unfortunately, federal policies haven't kept up with that. And a lot of employers, Amazon is one of them, are doing a lot to allow for parental leave amongst even fulfillment center workers and lower wage workers. But unfortunately, at the federal level, there still isn't such a policy on the books. Whereas with family and medical care, people tend to think of those very differently. Family care is about, your older parents, can I take time off to take, my dad or mom to a hospital, or if they need long-term care, can I stay home and do that? With medical leave, again, very different issues. So even though, what was striking to me was that if you look at the traditional sort of political, like the bill on the books, the Family Act is about all 3. If you look at the Family and Medical Leave Act, the FMLA, is still about all 3. You can get 12 weeks of unpaid, job-protected leave for any of these 3 reasons, whether you're a new parent, you have an illness, or you have family care needs. The working group very quickly said, we are not going to take a position on all 3. These are 3 different policies, and let's approach the first one in this first year. So our first report was just about parental leave. And I think what we did, which was unique and different at that time, was actually put together a ton of data and evidence, right? Who has access? And I think the surprising finding for a lot of us, was maybe not so surprising, was really like, yes, in fact, a lot of employers are providing paid leave. A lot of low-wage workers are actually the ones who are struggling because they have hourly jobs. Hourly jobs don't always guarantee them paid leave. If they have a ton of turnover, if they're moving from job to job, again, they don't have the required tenure to even apply for unpaid FMLA and so on. And I think that was the one finding that really, struck even with the Republican staffers. So I was at AEI also at that time, where a lot of, Republican sort of people on the Hill would reach out and say, well, what are you recommending? What are you coming up with? And we quickly realized that, yes, there was actually agreement in principle that Republicans also wanted to do more on parental leave. They also wanted to do more on paid leave in general. But the idea that there was this, this Family Act, and it was already there, and either you were supporting that or not supporting that, was just off-putting, and they were, people did not want to engage in that debate. So when we put that report out, I think as, from AEI, which is considered a conservative organization, I think it just opened people's minds to the idea that, yes, there is some way to move forward on this. You don't have to go the whole hog. Like Mariah said, it's not about, it's not about the 12 weeks or the, the 30 weeks that people may want. It's literally, do we agree in principle that we need to have this policy for workers and families in the US, and then get down to the details of how do we make it happen. And I think what I find most optimistic, even though we've talked a lot about division, in the US on different policies, is it's all the new Republican proposals on paid parental leave that have come out just in the last 5 to 7 years. Before that effort, and I'm not crediting us for bringing that about, but before that, there really was nothing on the books from the right. So I truly think that there's been, the fact that there are proposals on the books, that there are bills on the books, that people are willing to engage in that conversation, that there's a bipartisan now working group on paid leave, in the House and on the Hill, and people are trying to understand how do we do this, how do we agree on, the design of the policy, but they've moved away from, do we need the policy or not? Like, I think that that's a success. I view that as a win. And I'm, really optimistic that once those conversations start, we will get somewhere and we will, see change happen.
One of the recommendations in the report was something called a cross-partisan index. So Elizabeth, you've been excited about that. Can you explain what that is and why you're excited about it?
Yes. So I am a data nerd. Out myself as I'm a social scientist by training, and my entry point into the policy world is really around connecting the dots between evidence and policy action. So that's my starting place. So it's probably not surprising that I was one of the folks that came out of this this work really excited about the fact that one of the recommendations was some kind of data work. And I wouldn't actually call it a cross-partisan index. I can't remember actually if we specifically used the term cross-partisan. I want to leave the word partisan out of it entirely and just think of it as essentially a kind of family flourishing index. And just going back to the point that I made earlier in terms of where we started with the idea of flourishing and then thought about what does it actually take to flourish, right? Like, and what do we mean by flourishing? What's the outcome that we're trying to measure for? And what are the inputs? What do we think might actually impact flourishing? That's a data question, right? Like the data nerd in me is like, that's like, there's a model, right? You can sketch out a model for what kind of causes family flourishing if you define what you're talking about, and you can define the inputs that go into them and measure them. And theoretically, and the world does not work like social science models, so my point isn't we can just like calibrate the model and get it right, and like beep boop, like no. But we could actually be measuring what we say matters, right? We started identifying what matters in the family flourishing, and we could measure for that in the same multidimensional way that we work together to say what are the different pieces that add up to actually accomplishing this. We could measure family flourishing in a variety of different ways that capture some of what Catherine talked about, for example. What are the different kinds of childcare arrangements? What are the differences in terms of who wants what, under what conditions, right? We could measure what do we do in different places in terms of adding up to getting there for folks, right? There's all kinds of data questions that you could put together under a pretty broad umbrella that Whether it adds up to an index with like 1 number or 5 numbers that you could track over time, or whether it's really just a data resource for anyone bought into this idea of actually making progress on making the US a place where families can really flourish. We should be measuring that if that's what we care about. And so the fact that this group of not data nerds came out saying, hey, like, we have some of the evidence that we need, but like, it's kind of all over the place. There are things we can't all agree on. Like, we just need a place that we all agree and trust will let us actually understand what we're talking about in a really rigorous way. So that to me is like, that's like music to my ears, because we can do that, right? It's not a like, we have to just kind of like slowly chip away at hopefully building consensus and getting Congress to pass something, right? We can actually create data resources because we can ask people questions, we can use existing assets and pull them together and make them accessible to the array of stakeholders that Convergence brings to the table. So there's like a ready-made hungry audience for this. That is, I think, tremendously exciting at a time where it feels like hard to know exactly where to start and whether there will be a concrete there at the end. We can also use it to track progress, right? And again, you know, my Point News Institute, which has done this on a variety of federal policy areas, so I know it's possible. I'm not a microsimulation person, but I think about what Urban has built on some other outcomes and think about the ways that we could blend that and really actually say if what we're trying to accomplish is moving the needle on X outcome, Y outcome, Z outcome, that we collectively kind of reflects what this group saw as the values, we could actually track some progress or say, if you did policy option A versus policy option B, here's what that might mean on this outcome for communities A, B, and C. That's really tractable, and it's something that I think policymakers could use and have those fights be less about ideology and more about the outcomes that they're theoretically all trying to achieve on behalf of our country.
Thank you, Elizabeth. I think you all can feel how exciting this work is and how excited we all are about it. And one thing that's been exciting is that the work has gotten some pretty good traction. We had a launch event on the Hill that Senators Gillibrand and Cassidy hosted. We've had coverage in the mainstream media. We've had events at Brookings, much of it driven by our wonderful collaborative participants. Some more popular places like Abby, who you saw up there, who couldn't be with us today because she is a working mom of 3 kids, is going to be on Emily Oster's podcast. So if you have young kids, that's probably a podcast that you listen to. So we're really excited about that traction, and we want to bring all of you into the conversation. But real quick before we go, I'd love to go down the line quickly one more time about what's one of the things that you think has a lot of potential coming out. Well, maybe you covered that, Elizabeth, but something that you're excited about, where you think the work might move forward from here. Whoever wants to start.
Here we go. Yeah, so I think to me it's really been so actually fascinating to see how excited people are about the fact that this report exists. So, you know, getting things done in the real world, this is a long process. I am actually very on board with Elizabeth, thinking that would be an extraordinary thing in and of itself. You know, I guess there's a business saying, what you measure gets managed, right? So I think that piece is essential, but I also think people are just so excited to think that people could get together from different parts of the ideological and sort of different positions in the world and come up with a shared sense of what matters and some very specific ideas for how to advance that. That just having that in and of itself out in the world, there was a long piece, some of you may have seen in the New York Times, simply because it's like the world is dying of thirst, and this was like a little cup of water kind of a thing. So to me, that has been, I'm very proud to have participated in something that is out there in the world, that is hopefully going to result in lead to some concrete things, but is also just signaling to people, this is possible, and this is what we need to be doing a lot more of this.
So I think, Mariah, like we've accomplished a lot. I think just getting the group together, as I said, listening to each other, hearing different perspectives and figuring out what we need to do next and how do we actually turn this into actionable, goals, goal setting for ourselves. That in itself was a huge accomplishment. But in many ways, I feel like the work is just starting out, right? Like we've mentioned so many different policies that we would love to sort of bring to the world, and we feel like there's change possible, and we need federal and state policymakers to be debating and thinking more about. So I'm really excited about the next step, which is the data and the evidence and the building the case, because I do find from the work we did earlier that really moves the needle, right? Like people are very hesitant to commit to doing stuff if it's all talk. But I do think people are ready to move if you say, here's the data, here's the evidence, here's why you need to do this, and tell me why you're not doing this. So I'm excited about the next phase, and I hope we're working towards that, is really building up the data and the evidence for supporting the actual work and pushing policymakers in the directions we've laid out in the report.
So I get to answer this question twice, I guess. You heard my first one, but I want to circle back to the points that Aparna was making on paid leave. I was part of the AAI Brookings paid leave working group, as was Abby McCloskey, who directed this work. And two things. One kind of side point, and then specifically on paid leave. I think it was actually incredibly helpful to have a small number of us who had done this work before on a particular topic and had built rapport and really understood how to disagree. I think Abby, I don't know if you and Abby disagree, but I know that Aparna, Abby, and I don't necessarily see eye to eye on what to do with the evidence. But I think we all felt, coming out of our last experience, a lot of trust and respect for the fact that all of us started with that and then could use that to actually build shared principles and move forward. So to have that kernel to sort of build around in the context of this work, I think was part of the many reasons that made this project especially fun and successful. On paid leave in particular, I'll say that I think, and maybe this is because of that former point, that there were a number of us who had worked in that space. This may also be because it's an issue near and dear to my heart that I've done research on. I've worked in this space before. But I do think that sort of seeing the continued snowballing of consensus around evidence, and it isn't, to be candid, necessarily my preferred approach to how we would go with policy, but I also think that you have to start somewhere, and there's a certain path dependence that can grow if you're intentional about it and continue to kind of collect the evidence and ask the right questions and get the answers in the right hands. So I'm more optimistic than is maybe rational, given the state of the country, that we could end up going somewhere with paid leave for all of the reasons that Aparna detailed quite beautifully earlier.
Thank you all. So we want to open it up. Questions, reflections. What would you like to share, Rami?
So I appreciate the presentations, process, and so on. Pardon me. One of the things I'm trying to glean from this conversation is, was a consensus reached on any explicit policy recommendations? So that's the first question. Related to that question, if a consensus was reached, how is that going to be carried forth? Are any of the participants or others moving forward with that consensus approach in a way that could translate ultimately into new public policy?
Whoever wants to do. I can take that. So I think what we presented in the report is, how I thought about the A.I. Brookings report is like, this is the sort of the compromise solution, or this is what most participants agreed to. So you'll see specific proposals in the report, 12 weeks of paid leave, and then, cash supports for children, for families with children. There are specific elements in there. I don't think that means, and you can correct me, Mariah, that everyone sort of said wholeheartedly, yes, this is the best solution out there, right? I think at the end of the day, the idea behind the report is we've all come together, we have our differences still, we still, disagree on a few things, but here's what we can agree upon, right? And that's what we've put into the report. And there might still be people in the group who are not wholeheartedly, have come along with all the suggestions in there. But I think that that's the beauty of sort of working together in large groups, that yes, there are still things we can agree upon. And it's like I said in one of our conversations earlier, it's a microcosm of what you see happening in politics, in DC, right? Like people have their differences, but at least if there's some kernel of, we do agree on these few proposals, these few things, there's a path forward, right? And I think what Convergence is trying to do is really, I don't think we're stuck to, yes, it has to be 12 weeks or it has to be, cash supports in this manner, but it's a starting point. It lays the foundation for people, for us to go to, I guess, policymakers and states and, people who think actively about these policies to say, look, here's a foundation for how we can get agreement, and, we can work out the designs, but we at least have a way of getting people to work together, and here's proof of that. So that's how I view the work we did, but I'm happy to get different perspectives.
And I would just add to that. Did I do that? Does that work? Yeah. It's kind of like a Venn diagram, right? I mean, it's. I would say that middle part is what we got to, and there's nothing in there that no one can stand.
Yeah.
I mean, that we did draw a line. There were some things that had they been in there or not been in there, I just couldn't have, right? So it's not like, well, I love this part, but this part I really always hated. No, it's made very clear that there's a set of things. If you look at the report, I think you will, as a part of us, we all were actually when we saw it, surprised at how many concrete things there are. And there's a vacuum. There's just a vacuum there this is just filling a little bit of it, which is a group of people, credible people, who are coming from multiple different perspectives and places in the world, who are stating, kind of at a bare minimum, this is, number one, we should be thinking about flourishing families. Just the very fact that this group got together and said that, who I don't know of anyone else who has said that across these sorts of, lines, and that there are concrete things which serve as a starting point. So I think it opens up discussion. The fact that we had 2 senators at the release event. If this were something that every day people were asking them to speak it because they were releasing some report, they wouldn't have done that, right? This was seen by policymakers as something that was quite unusual. So I think that it's like a butterfly wing that is going to cause ripple effects, is the way I kind of think of it.
Can I make one more? So just the most specific one, and this is not to hammer home paid leave, but I do want to just articulate it because I think that there are while there are lots of policy details that we don't get into, and there are certainly the places where the bipartisan negotiations that feel like they've been going on forever are going on. At the same time, there are certain things that we did spell out as sort of consensus principles that I think reflect significant progress from where we were before this report existed, or before this process started. And that's 12 weeks for starters. Like that is, everyone agreed to 12 weeks, which is evidence-backed, but it's not necessarily the starting place for folks on either side of the partisan divide. We specified parental as opposed to maternity leave with a pretty generous definition, I think, of what parental meant. At a minimum, moms and dads, including for adoption. And I think we went a little bit farther than that, which is also not necessarily where even conversations now are starting in terms of bipartisan conversation. There are probably other pieces as well, but just those 2, to be able to put out those 2 specifics as cross-partisan, nonpartisan principles that should be part of any paid leave. Oh, then it should be federal. Those 3. That's a really big deal. It shouldn't seem, I don't know if it seems like a big deal to this crowd or not. To the paid leave world, maybe not. But to have that be articulated so clearly and unequivocally as consensus policy principles as a starting place, I think is actually a bigger deal than the folks in the paid leave nerd world might fully appreciate. And so I think your question is really well taken. Are there specifics? And that's an example of something that, depending on where you sit, may or may not seem specific, but I think actually is fairly specific given where the debate has been and is going right now.
We spent so much time on that.
And the other part of the question, how we're moving it forward, Aparna is working with a participant from Walmart and the Chamber of Commerce to share the solutions with private sector employers. We're working with the National Governors Association to share the solution at the state level. So we continue to do much work with the participants to advance the solutions and hope to see some of them adopted. We have time for one more question.
Also, really quick, when you ask your question, if you could introduce yourself, that'd be wonderful. So, yeah, I saw 2 hands up.
I'm Maria Gomez, and I'm a guest of Store Butler, who is the leader of an organization that ran. But I have a couple questions. A question, and I was wondering if it came up in the conversations about, because it is about flourishing families, and so I'm wondering if the issue of wages, sustainable wages came up, and the issue of tax reform, if that came up, tax distribution among all of us, and then the other one was around the entitlement programs, whether those programs could be delivered in a more friendly way to families. So those 3 issues, if they came up.
So I think the answer to all of this is no. And that was actually, okay, well, I'll get you with food. Yes, to some extent, right? But this is the thing, you know, I mean, we have, as everybody in the room is well aware, a whole lot of problems, and they're just gigantic. And there tends to be, number one, we're only talking to people who agree with this. Number 2, there's this immediate snowballing effect, right? Everything is connected, right? Of course, if people made more money, then one of them could work full time and support the other one staying at home with their baby, as many want to. That solves the child care problem. That solves the paid leave problem. So that would make me very happy. The problem is that, and one of the things that was really, I think, brilliant about the way Convergence managed this process was we were not constrained. So there was no indication that we'll talk about this, but we won't talk about that. The group was sort of guided through, number one, defining, as people have said, what are we talking about? Flourishing families, and really bringing everything back to that and making it narrow enough.
Hello, my name is Abby McCloskey.
Abby has an opinion on this one. This is like they're rolling the credits. We've gone over time.
So I think so what was, I think it is, all of the things that you mentioned came up. But there was a group sense that we aren't narrowing this to a point of meaninglessness, but we're drawing the circle smaller around what's directly relevant to children and families, even though all of these things are connected to everything else. I think had we gone down that road, we would have probably gotten nowhere.
Yeah, I think we pretty explicitly said we were not, this was not about job training and workforce. Right. Those are challenges we do need to address. But if you think about even the policies we did talk about, I think there's a direct connection to work. There's a direct connection to, our mothers dropping out of the workforce because they don't, they have a child and they're no longer able to participate and they're not getting, leave in order to take care of their families. So I think it was a little bit indirectly addressed, but I think there's a direct, other projects coming up around workforce training and wages and so on.
I know we're over, so.
All right, well, I'm painfully aware that we have not had enough time and that we could speak with these wonderful women all afternoon. I'm not sure how long all of you are able to stay, but we will have breaks and a reception where we can continue the conversation, but truly am so grateful for the time that you've dedicated to the collaborative and for the work that you continue to do. And as we talked about and as you pointed out, I always have to say to groups, I know you feel this huge sense of success that you developed these consensus solutions, and that was the easy part.
Yeah.
And now we have to work together to advance them in the world, and so you all are continue to do so much on that front and to be here with us today and so grateful and we're so excited about the work that you're doing and continuing to work with you. So thank you, truly.
Thank you.
But I just want to give you a little bit of background as to why we're working on this project and how, to some extent, it differs a little bit from what you just heard in terms of the dynamics of it. And then I'll introduce our three representatives, three stakeholders, through the many stakeholders in this project.
That's the best I could do.
I guess I know where I am on the project. If you look at the research on healthcare, it pretty much shows that roughly 80% of somebody's health status, health condition, is actually due to lifestyle and social factors, like housing, nutrition, and so on. Only about 20% are due to direct healthcare that they receive. I mean, there's arguments about the numbers, but it's a fair approximation. And so these factors, these things that affect one's health and the health of communities are clearly major factors, major drivers of health care. And sometimes people refer to these as social determinants of health, sometimes drivers of health, sometimes factors, as we are doing here generally, or health-related social needs. There's a whole lot of vocabulary about this. Most countries outside the United States have tended to focus more on those issues than we have. If you actually look at spending on social services and spending on healthcare in most industrialized countries, you can see very quickly that we are an outlier. America's attitude to the health system, I sometimes say, is like a repair shop. When a problem has happened, we'll come in and try to repair it very expensively. A lot of other countries tend to address these issues a little bit upstream, as we call it. So there's a lot of understanding of this. And that's reflected also, that way in which we look at these issues in the United States, in the policy architecture for health and social policy. We find that when you look at payment systems and budgets, at the way departments do or don't work with each other, they're very much affected by this belief, if you like, that repairing is better than preventing. And so that's the bad news, that we're not doing a very good job as a nation in this area. The good news, however, is that things are changing. We're seeing, first of all, health providers, health systems, focusing a lot more on some of these upstream issues of social determinants, investing in those issues, exploring them, researching them, and so on. We're seeing other sectors, like housing, social services, nutrition, and so on, beginning to stress the importance of what they do in terms of its impact on health and potentially the cost of health and the quality of health in the future. And I would say that also all levels of government now, as opposed to just a few years ago, are sort of waking up to the importance of collaborating across departments and across sectors in order to achieve a better health system. So that's what's going on. And so in many ways, the timing is perfect to look at restructuring this policy infrastructure to make it much more likely to induce and to incentivize the different sectors to work together in order to achieve a better health system and better health outcomes in communities and in households in this country. So we're at a very critical phase, if you like, in this whole self-examination of why is it that we spend so much more here, such a higher proportion, but our outcomes really aren't any better than most other major countries. Well, that's where convergence comes in, or came in. Convergence, as you know, as you've heard, is an honest broker or a catalyst that brings together people with different ideas, maybe different philosophies, and so on. And so what we did in the beginning of this project, it's really the late summer, is to bring together initially 30 or more organizations, stakeholders, experts in this whole area of social determinants. We brought together a group that included major health systems like Kaiser Permanente, United Health Group, and also the Association of Health Insurance Plans. We brought together housing organizations, such as the Council on Large Public Housing Authorities, which is the umbrella group of all the major public housing authorities in the country. We brought together social service organizations, some of which you have here on the panel, such as the Catholic Charities and Lutheran Services. We brought some of the government organizations and associations in this area, particularly the National Association of Counties, I'll mention, that you've heard of already, but others too. We brought together nutrition groups, including Meals on Wheels. We brought together Walmart, which interestingly has been very much involved in, not just for its own members, its workers, but also its customers, looking at this whole issue of the various social factors in this area. And we brought together some observers from government and other institutions to begin a process that started with a series of brainstorming sessions to say, what are the issues, the top line issues that really you feel are very important? And so we did that. And then since January, we've been holding a series of meetings, all virtual. In fact, I've only met one of my panelists before in person. But we brought together people to really start to look at the various ideas that they and others have to look at addressing this issue, and to begin to see if we can put together an agenda, a set of proposals that all could agree on. And what we've been doing really at these meetings is what I call stress testing. We put forward sort of proposals that have come out of the brainstorming that we initially did and the meetings as they go along. And we submit them to the group and start to see what kind of reaction. Are we on the right track? Are there things that we shouldn't be talking about? Are there big issues that we've got to kind of deal with? And what we find in this particular project is less philosophical disagreement, I would say, and more a question of, because of people's background and their perspective and their experience, different feelings about the importance of different issues. We have a lot of, I think Y is the important issue. I don't really think X is worth worrying about. And then another sector will say, oh, X is what we've really got to deal with. And I have no idea what Y is, so I'm not interested in that, right? So, I mean, I'm overstating it, but that's more the division based on experience and so on. So this project, in a way, serves two purposes. The first is to actually, which we have done a lot from the very beginning, to get people to share their experiences from their sectors. What's going on in housing that is so important to health that everybody else should know about? And what policy obstacles are there? And what policy changes should occur? So a lot of it is kind of sifting through people's experiences rather than having the kind of fundamental disagreements that you've heard about in the last panel. And then the second objective is really to draw on all of this, and this is the process we're in right now, as I said, to say, okay, can we draw from this? Can we get the different sectors to appreciate the importance of policy issues to other sectors to such a degree that they can all agree on a set of regulations and statutory changes that they can all join behind? And the idea is to kind of add and multiply, so that instead of only health organizations pushing forward for certain changes in the health system, we have hopefully housing, social services, nutrition, transportation, education, and so on, also supporting that, and therefore making it more likely to happen. And similarly, when organizations from, say, the social service area come forward and say, this is really important for health, they're not a lone voice. Others are doing the same thing. So it is that add and multiply concept. We are hoping and anticipating that we will get a final agreement if everybody is able to sign off on it, and we will get into some of the micro decisions about that you heard about in the first panel towards the end. We're hoping to do that by the beginning of the summer, and then to have a final report published and out in good time for an election discussion, but really for the longer term. These are mainly, we're looking at policies that really are long-term in terms of their focus. Now, we have three of our stakeholders with us today, and I'm delighted. As I said, I've met two of them virtually, and only one that I've known for some time. And first of all, Sue Poehler, sitting right next to me, is Vice President of Public Relations and Government Affairs at the Lutheran Services of America. However, I got to know Sue when she was at the National League of Cities, working on these exact issues in terms of the well-being, health and well-being. And she's been a strong, social determinants has been a strong focus of her work really throughout her career. And next to her is Ipyana Spencer, who is Chief Health Officer with Meals on Wheels America. And she oversees Meals on Wheels Health, which is actually a newly created division of Meals on Wheels that partners with health payers and health systems to expand the impact and scope of local Meals on Wheels services. And she's had many years of experience in the health sector and also in public policy on in national and state and local. And then last but by no means least, Brian Corbin, who is Executive Vice President of Member Services at Catholic Charities USA. And Brian facilitates an interdisciplinary team of experts in programs and services and disaster operations, government relations, and so forth. And this team supports all the Catholic Charities network around the country in these areas. And he spent, incidentally, not just at the top level of the organization, but 27 years out in the field, seeing these things up close and personal. So we have three really great representatives of our group, which I said is well over 30 people, and so far we've been getting on fairly well. I think
We're still here.
We're still here.
No bloodshed.
We have very few dropouts and so forth. So let me begin just quickly going down the group and just the panel and just asking, first of all, why do you think social determinants of health, or whatever we want to call it, is so important to your organization's work? And as I've stressed, each of these organizations here is not a health system. So why is it so important to you?
I can't say it.
Is there anybody under 25?
Hold the,
I mean, I'm just
the mute button that's on the left, you just hold it down on the
Oh,
screen.
thank you.
Well,
thank you. Sorry.
So,
I'm happy to go first. So again, Sue Polis, and as Stuart said, we really met when I was with the National League of Cities, and social determinants of health, right? We probably all say it somewhat differently and similarly, right, what that is to us. But really, in terms of how we look at it at Lutheran Services, right, it's all those differences in how well we live and how long we live based on where we live, right? Our social environmental factors, chief among them. And so Lutheran Services, much I think like Catholic Charities and Meals on Wheels, right, we're a little downstream. We're trying to help connect people to support some services that they need, right? So we can address their holistic health-related social needs or social determinants of health. And so when Stuart reached out, I was still in my previous role, and I said yes immediately, because who's going to solve these complex challenges on their own? Coming from the cities and Trust for America's Health, where we were working on Affordable Care Act implementation, really, which put some wind behind the back of this conversation around population health improvement. You know, pick an issue, housing, education, they're all connected to health, but people look at them very uniquely through their own lens, right? Whether that's transportation or nutrition. And so it's not so much that we don't want the silos, they're needed. You need those deep silos because you need that strong understanding. But really what I think Stuart and this group is doing is building those bridges to connect across. Because this is really all about alignment and how our sectors have to come together to deliver on systems change and deliver on policy change. And so knowing the complexity of the task, the group that's been assembled from all these different perspectives, governmental, non-governmental, funders, payers, providers, social service providers, it's just, there's nothing else like it. And I think we're really going really deep to pull up on a policy framework that's gonna have lasting effects probably for the next decade and beyond.
Good afternoon. Can everyone hear me okay? I can't tell how loud I am. I've never been told I was soft-spoken, so hopefully I'm not blowing anyone's ears out in the back. Feel free to raise your hand, I won't take it personal. So Ipiana Spencer with Meals on Wheels America. It's a pleasure to be here with you all this afternoon. So I think the draw for Meals on Wheels America at this conversation personally came from the fact that having worked in the Senate and in the House on social policy issues with appropriation, so understanding the funding and where the silos tend to originate is typically happens with how they're funded, hence where the silos come from, and then ultimately where various stakeholders are and how they're advocating on behalf of those communities that they're representing. And then when you go to a health system, you realize that there are fundamental costs in the system that need to be covered. And that's not a bad thing, it is what it is. But there are also some realities that kind of meet the road, and you have these conversations that often exist in a good and bad or right and wrong structure where that ultimately ends the conversation. And the problems are so great and they're so incredibly important that we need to get past that. And so the appeal for me in representing Meals on Wheels America in this on this kind of stakeholder group that we're in is really trying to figure out how we can bring the resources and the knowledge that we have from our local programs who are serving people in very, very different communities across the country together with those systems that are existing alongside them in these same communities, but also in places where they're not used to talking to. So they're not used to talking to the AHIPs of the world. They're not used to talking to some of the county organizations. They're not used to talking to elected officials at certain levels around housing or transportation or other aspects that impact how they do their work, who they serve, and how they're able to serve them. And so for me, personal passion is figuring out how to connect the dots to these big challenges that we all face, because you can fix housing. If you don't fix transportation, you haven't really fixed housing. If you don't fix education, you're not really impacting nutrition. So all of these things are connected, and for me, it's great to be on these calls. I'm like the connector nerd, so I'm like, yay, it's time to talk about policy, in a way where we're really looking to address how is it that we can all get on the same highway towards the same type of change for all of those communities so that we're not leaving anyone behind, we're not focusing on one industry. I always say if you're not at the table, you're on the menu. So the fact that everybody is at the table and able to represent those people that we're serving is incredibly crucial, and we're absolutely pleased to be a part of the effort and look forward to time to come.
Well, thank you. I'm Brian Corbin, Executive Vice President for Catholic Charities USA. I came to this table for kind of three interrelated reasons. The first one is about the very DNA of what the Catholic community wants to do, and I think we share a lot with Lutheran services. It's about the road from Jerusalem to Jericho in the Gospel of Luke, where someone got beat up, and the Samaritan stopped to help them out and brought them to an inn. And so the Catholic Church has seen itself as the inn and the innkeeper for 2,000 years. There were stewards of that innkeeper. But there's a problem with that road. Why is that 12-mile road so dangerous? And that's where the other part of the DNA of Catholic Church and Catholic Charities comes from, is the directive in Matthew 25, where we're told in order to gain eternal life, we must feed the hungry, give drink to the thirsty, welcome the stranger, care for the sick, visit the prisoner, and care for those in need. So that is the very DNA of what Catholic Charities is supposed to do. And if you list all those things, minus when I'm sick, you took care of me, but I can even make a case for that. Our mandate is in Matthew 25 that we do the social determinants of health. But the unique gifts of Catholic Charities is that we're connected to a larger Catholic healthcare systems as well, and work together. So that's one part of my journey to this, is our DNA. Second, when I became the executive director of Catholic Charities in Youngstown, Ohio for 27 years, in the mid-80s, the first day of my work, the bishop told me, we just had a steel collapse, and there's 55,000 people without a job, and male suicide rates is through the roof. Can you do something new to help these guys out? And second, by the way, we're in the middle of the AIDS crisis, and I have way too many people with HIV/AIDS exploding in Youngstown, and I need you to deal with that population. Fantastic, first day of work. So that was looking at healthcare and social determinants and housing and discrimination and all kinds of other issues kind of formed me to understand how to present this. And the third thing that happened for my 27 years is that I then became the president of the Board of Health. So I had a public position by the mayor and the city council. So I actually was a public official in that sense and saw that whole world operating. And then I became the treasurer of a major healthcare system and then the vice chairman of a major Catholic healthcare system within 18 states. And all of a sudden realized when I was the treasurer, wow, that's one hell of a budget compared to what I had in Catholic Charities. So started to look at those kind of questions. But the second part of that part was, and part of my Catholic healthcare journey, was as vice chairman of this major corporation. I was in charge of the Community Benefits Committee. How much money, what percent of our proceeds are going into community benefit, which is Schedule H for those who are IRS nerds. That was the thing that kept on driving me, like, this is not solving anything, even though we have a percent. And then part of that was then also part of philanthropy and appointed to us old Still families of philanthropy, their foundation, and trying to fund these things and saying there's no way on earth that philanthropy is going to deal with this. We have to look at new structures. So I think that those three ways brought me to, when you invited me to come to this, that I could see what was going on in government because I was there, I could see what was going on in social services and in healthcare finance, and just brought me to the conclusion that we've got to be part of this conversation. That's why Catholic Charities, our DNA, but also why we want to do it.
Great, thank you. I think it would be good to open up, if you're learning this, and maybe I'll spice a mini question as well as we go along. But as you get ready to ask a question, I'd like you to think about a couple of things, and maybe you can say this as you put the question together. One is, can you think of frustrating examples in your own community of where the failure to address some of these issues has led to, you could see, health issues? And secondly, and related, are there examples in your community, good examples, of where efforts have actually taken place to collaborate, to come together across sectors? We're always looking for examples anyway, but think about it in your own area. Let's start over here.
So this is interesting because this is exactly what I wanted to say.
Okay.
I was in the doctor's office the other day. No big deal. And I want to speak about Meals on Wheels. So this gentleman comes in to the office and he's talking to the receptionist. And I can't not hear, right? Because I'm sitting right there. And he drives for Meals on Wheels in my little rural community in North Carolina. And what he's there for is because he's delivered Meals on Wheels to two elderly ladies who he knows need doctor's attention, but they don't know what to do to get the help that they need. And so he's connecting the doctor's office to his Meals on Wheels ladies. And I thought that was the most beautiful thing that could possibly have happened to bridge that gap, because they didn't even know how to call or who to call. They knew how to use the phone. They didn't have iPhones, they had landlines. So number one, he said. And anyway, so he did that. And he went back and got their phone number and came back. I mean, I saw him come and go. So I just want to say thank you, Meals on Wheels, for the wonderful gentlemen in my community. The frustrating part is that if it hadn't been for him, nobody was paying attention.
That's right. So I just want to say, I love that story. And I often find that when I go to an event, someone had a family member who volunteered for Meals on Wheels or is still volunteering. So that's one of the benefits of being with an organization like Meals on Wheels America. So I'm giddy with that. So I can't wait to tell that story when I go back to the office.
Go for it.
But I do think, to your point, that's the intersection that often happens, that's often overlooked. Meals on Wheels America, as a national organization, is celebrating its 50th anniversary this year. We have members who have been around for as long as 70 years and longer. And so when we're having conversations now around, you realize there are social determinants of health. We've always known there were social determinants of health. It's kind of like the movement and the nomenclature is catching up to the organizations that have been providing these services for decades. And I think that's where some of the friction is when you have a structure that tries to go on top of an existing infrastructure that's been developed because of a lack of infrastructure being there, right? If you don't have a paved road, you have a dirt road. And that's where, they're trying to come over and put pavement over dirt roads and they're like, man, there's a tree right in this path. How are we supposed to deal with that? And so I think that captures a lot of it. But healthcare is also incredibly complicated. I worked for United Health Group, and when I get on the phone and talk to my mother's doctor or have to talk with my father's physicians, I'm like, what in the... And I understand the jargon. I could spit those acronyms back to them with just like the best of them. And I still am incredibly frustrated. So I cannot imagine what it's like for people who are at their most vulnerable, by themselves, add on non-English speaker, add on limited literacy, add on limited ability in terms of your ability to hear or see or even comprehend in terms of your cognition. And it is an incredibly vulnerable time for people's lives. And so when they go and they have that Meals on Wheels volunteer that's able to come to their house that they trust, they share things that they don't share, can't share with their doctors, with their health insurance companies. And it is crucial to be able to capture that information and that interaction so that you can help solve for that problem. When I worked at United, we knew that people didn't answer the phone when our nurses called because they thought it was a bill. So they saw that caller ID and they had studies of when before caller ID and after caller ID, the answer rate declined because people would assume that if you're calling me after I was in a hospital, it's about a bill. You're not offering me post-discharge meals. You're telling me I owe something, and I'm gonna let that call go to voicemail. And that's what ended up happening, is that you had this disconnect because people don't see their healthcare physicians oftentimes as their advocates. You see your doctor maybe once or twice a year. If you stop going to your doctor, does your doctor even know if it's because you found another doctor because you passed away? Do they know? No. Whereas that local service provider who comes to your house every day, they knock on that door, you don't answer, they're calling somebody. And so that's why having organizations at the table with healthcare organizations, with elected officials, helping to craft the strategy. Meals on Wheels, again, we're older, we're not the sexy solution, we're not the high tech, innovative thing that people kind of jump to or think about when they think of partnership. But there's something to being around for 50 years that makes you innovative, because you had to be there throughout all the things that have happened in time. And we're still here and we're still serving. And that knowledge, that on the ground knowledge that our members have, needs to be captured by the healthcare system in some sort of way. Now, how we do it, what they do with it, and how we ultimately get it back to improve outcomes is where I think this committee and of various stakeholders, where we all come together and have that conversation around, we all have value here. It's not just health plans or another big player over here. There are a lot of on the ground organizations that they're patching potholes in their communities every day with respect to the needs that they're servicing. And someone needs to have that information in order for whatever intervention that's worked at a national level to work and be impactful at the local level.
I think this is a really good example of the sort of the architecture issue that I talked about, and what this effort is about. Because the example of Meals on Wheels is somebody, an organization, is in contact, sees something that needs to be addressed, and has a procedure then, a follow-up to do it. And so a big question that we discussed actually about a month ago in one of our meetings is, who are those people? Of institutions? No. And so what changes would we need? How is it financed? If the health system is going to gain from this by reduced costs, should they be paying for some of these accordingly? That's the kind of in the weeds, if you like, nitty-gritty issue that is where it's so important to bring together stakeholders from these different sectors who all have a different perspective and a different experience with this, to say, can we find a common solution to all your problems? You know, we have people in the medical side say, I'm required to screen patients for social determinism. Now what do I do? You know, I'm emotionally upset that, you know what, this homeless person has come in for the third time in this year, and I know what they need, but I have no idea how to get that done. You know, and we're not even allowed to pay for it or to bill it. So, next question? Somebody over here.
Just as a friendly reminder, please make sure you introduce yourself too. A lot of people know Roxy, so I'll introduce her.
Oh, thanks. No introduction.
Hi, I'm Wendy Reed, and I'm curious because I was curious from the last panel, they talked about having this shared vision of flourishing families, and I think health is such a big, I mean, I can only imagine the conversations you're having about how to define what health is. Are we talking more about access? I'm just curious to see what your shared, if you come to a shared vision at this point of what you're after.
I'll let you answer that.
I still think we're struggling with that, I mean, in a good way. We're literally trying to put all those things on the table. We've only been meeting 6 months, maybe. Still just trying to get to know each other through Zoom, to be blunt. And I think we're just trying to get to those conversations in the sense of like so many interests and perspectives are in this whole debate about social determinants of health and well-being, including healthcare itself. So I still think we're starting to struggle with it and define it, and I don't think we're there yet, but I think we're having healthy conversations to that point.
Yeah, maybe just to build on what Brian's saying, you know, part of this, right, is mindset shift, right? That we have different roles and we have to recognize the role each other's playing, right, to build that alignment that's needed, right? Because you can have a great housing department in your community, but if it's not connected, right, to your health system or to link those people back to housing that need it, it's a system failure, right? You have to create that alignment. And so part, I think, of why this has the potential to be so transformational is because it's giving us the depth to really understand each other's roles, what our barriers are within our constraints within our different silos, and pulling up then on what's needed to address those gaps, including, right, like whose job is it to address social determinants, right? It's no one and it's everyone, right? So do we have the roles in place to really do this in the way that it needs to be done, right? And so that's why this is so, you know, important, because there's not really a table set like this anywhere else that's exploring so many different facets of what does this really look like across, right? All those things you talked about, financing, partnerships, et cetera.
And I also think a lot of it is we're still having those conversations within our own organizations. And so I think some of it is, while the person who leads X, Y, or Z effort at, you know, ABC organization may think this is a great idea. They might think that this is the definition of, you know, SDOH. Boom, got it. They go talk to someone else and they're like, no, we're not, no. We do health because that's what we get paid to do, and no, we so go back. And so I think some of this is, it's challenging because it forces us to ask our own organizations where we are and assess where is it that we want to be and what's the role that we want to play to either get there, or are we content in being this, you know, the speed bump in the road, and what does that mean? for the organization and ultimately what it is they're doing and how they do it. And those are hard conversations to have internally in organizations. You know, and I think that's where I think a lot of I know for us, you know, folks are like, why are you guys in health? You know, that's what we do. You know, we don't provide meals just because we're like, meals are good. You know, we provide meals because they keep people healthy. So yeah, I think that has I think we have a lot of questions that come up that cause us to question internal things as well, and I appreciate that very much so.
You know, I mean, given the look, we can wrap up very quickly.
At least they didn't play a video in yours.
That's true. Yeah, I hope you'll make a video on this. But anyway, I just wanted, I've been involved in many projects, many of these collaboratives for many, many years. And each of them has a different kind of like personality, if you like, or a slightly different function. You mentioned the vision. We've had a couple of projects I've been involved in, one on K through 12 education, actually one very recently on older adults. We're getting that vision was really central. Can we all agree on what the world should look like if we move forward? And that actually bound people together. This is a little different from what you've heard. It's more people doing things. They're in their sort of sector, not necessarily silo, but their sector. And what we've been doing is really trying to sort of work through the fog, if you like, to say what are the things that we are seeing coming up constantly and why. And so a good example of that is, which you all know, we had a very lengthy discussion at the last meeting about the whole notion of hubs. Should there be some institution, either existing or new, in a community that actually becomes this sort of funnel for assistance or for support for these various sectors working together on social determinants of health? Because we want to, the discussion went along, because we want to have people who understand the community. The federal government does not understand my community. The money may come from this, so let's start thinking about what is the structure that allows the money to come from HUD and HHS and these others, come down to some institution and then be sort of mixed together so that Meals on Wheels gets money that allows it to do different things, not just nutrition, but the coordination and so on, because they can't do that right now, or at least they couldn't do a lot of that until recently. That's what we really end up discussing. So it's not so much a vision thing, it is much more kind of what's the mechanical kind of architecture that we come to realize as a group is so important to us and to the whole objective. And then what do we need to do to realign policy to make that happen? You know, that's kind of what we're doing. Very different from our K through 12, where we have the unions kind of at the throats of the homeschoolers and so forth, and saying, do we really need to meet again? And so on. And so we said, okay, stand back, think 20 years ahead, forget everything that you've been arguing about in the last 6 months. Where you go? It's not like that with this project.
Yeah.
Great, thank you.
Thanks to Stuart and our panelists. I promise, Stuart, we value you more than the size of your team would show. So we're going to shift the agenda by about 10 minutes and ask everybody to stay at their tables before we break. Introduce yourself, where you're calling in from, and the opening question we have is, well, I guess it's midday question that we have now, is what's making you hopeful despite the division in America today? We'd love for everybody to take a couple minutes to connect with everyone at your table.
Cooperation. Oh, it's Ron Pollack. He used to lead a group called Families USA, which worked on healthcare. Not enough social determinants of health, but we tried. I just want to say I very much appreciated the spirit behind the conversations. I think there's a challenge which I want to just raise. And beyond the cooperation and collaboration, I think there's got to be explicit outcomes that are substantive. And I think it would be an extraordinary contribution if for each of the different collaboratives that Convergence is organizing and leading, that there be real explicit understandings of concrete policies, proposals that are actionable and that can be carried forward after the process is completed. And I think to make that happen, it's really important to have key stakeholders in that who are motivated to actually be the folks who are going to carry forward whatever gets decided. And I would just urge as greater specificity to the extent it's possible in terms of substantive outcomes, and that there be then a follow-up process to help make that happen.
Thank you. That's really good feedback, Ronnie. And we are right now for the Families Project, we're in the impact and implementation phase, and it's worth noting that hopefully you guys have seen our Supports for Working Families final report, the Blueprint for Action, but in there we also have 4 one-pagers for each of the communities where there's calls to action. So we have a state government call to action, we have a philanthropic community call to action, we have a federal call to action, and we have an employer call to action. And right now we're actively working with our participants to lift those solutions up and doing a lot of different presentations with our participants to different groups and doing what we can to move those forward. So certainly it's top of mind for us too with that project right now. Anyone else want to share an observation or a theme that emerged from connecting?
That there is hopefulness.
Yeah. Right? I mean, what better way to end to go into our break? I'm told I should have brought a bullhorn, and I did not. So next time. So thanks everybody for getting a new seat, getting new neighbors. I'm really excited to introduce you to Gideon Cohn-Postar, who's the legislative director at Issue 1, and then Monica, who is our senior director of programs, who's co-leading this project, this partnership project, and they'll talk a little bit about set the context for this project, and then we'll have you all weigh in on the questions that we're asking in this early discovery stage, and take that with us so we can shape where this project goes. So without further ado, Gideon.
Thank you so much, and thank you also for having me here. It's great to be part of the Convergence family now.
Yeah, you're part of the family.
I don't know if that's legally. Yes. So hi, my name is Gideon Cohn-Postar. I work at Issue 1. Just as a quick background, Issue 1 is about 10 years old. It's a bipartisan, cross-partisan democracy advocacy group. We work on money and politics, tech and media reform, but most especially we work on strengthening democracy in our election system. So we advocate for election funding for state and local election officials, protections for those officials, and just improving the information environment that they function in. So it's very busy at the moment, and things are generally going not well. But we are doing our very best and advocating at the federal level in particular. On this project in Democracy 250, we are remiss if I didn't mention our partners, More Perfect, run by John Bridgeland, a fantastic organization that works not just at the federal level, but at the state and local level as well to bridge divides and improve democracy. And so just to give a quick background on the work that we charged Convergence with, we realized, and our CEO, Nick Penniman in particular, realized that the anniversary of the Declaration of Independence, the 250th anniversary, is coming up in just a few years. So July 4th, 2026 is America's 250th. And we were a bit underwhelmed by some of the efforts in play to commemorate it because they were symbolic. And we believe in symbolism, but Issue 1 is all about legislation and trying to get enacted a pro-democracy, very thoughtful and informative and helpful bill that would improve democracy and specifically strengthen and expand democracy in the United States and in a broad sense, democracy defined very broadly. So coming up with that bill was a thought that we had: how could we associate a bill, a really transformative piece of legislation, with America's 250th anniversary, kind of give it that added impetus to pass it, kind of a hook, but also potentially a strategically timed moment. So July 4th, 2026 will come midway through the 119th Congress. July is often when big bills are passed, in part because Congress wants to leave for August, because no one wants to be here in DC during August. So a lot of our focus has been on trying to figure out, okay, what could a bill like that look like? And also who should be there, not just in terms of enacting this kind of legislation, but also in terms of advocating for it on the outside. And that's where we came to Convergence. The big thing that we have asked them, and I suppose in a moment we'll charge you with, is figuring out what should steps to secure democracy, to strengthen democracy look like, what are the biggest threats, and who should be at the table, and who needs to be at the table. A lot of our work falls within what we often playfully call democracy world, all the people who work in elections and democracy, security, and money and politics. But that's a relatively small community, though it has started to grow. And it's also not a particularly diverse community a lot of the time. And so determining who should be at the table, who traditionally hasn't been when we've talked about democracy legislation, is a really big part of what we've asked Convergence to look into. So with that, I'll hand back to Monica, and looking forward to the conversation.
Thank you so much, Gideon, and you all are lucky enough to hear me croak through. My voice is a bit gone today, the next several minutes, but just wanted to build on some of what Gideon shared, which is what we think makes this effort so unique, even though I'm sure it sounds really ambitious to you all. I'm sure there's some skepticism in addition to the hopefulness that our connecting question engendered. And part of it is just the uniqueness of our partnership. We have Issue One and More Perfect, leading organizations and building these bipartisan legislative alliances. We have Convergence, Stuart mentioned earlier. There's something unique about the fact that we're an honest broker, we're a neutral convener, we're a catalyst. Something around the timing, around the 250th. There's going to be a lot of attention there already. And then the fact that, Ron, you said you wanted more concrete outcomes. We want a bill, we want a democracy strengthening bill. So all of this just feels very exciting. A little bit about our process. To those of you who have been at Convergence for a while, you may recognize our research process. We call it a discovery process now. To those who are new, just to give you a bit of a flavor of what we hope this process yields. And it consists of typical research things like a literature review, interviews with a very broad spectrum of stakeholders, a workshop, but more specifically, we hope it yields a few things. How to best frame and scope this issue, what is a unifying frame? What are some specific policy areas that are ripe for bipartisanship? Or if that's a little bit difficult, what's a stuck issue where if we inject this very evidence-based collaborative problem-solving methodology, it could really move the needle and make a difference? What is the spectrum, the full range of participants with the perspectives and the influence necessary to get these things implemented, these policy ideas? And lastly, how do we design this process effectively? How do we communicate and explain it to involve broad participation? How do we engage policymakers effectively, like incentivize them to come to the bargaining table in the first place? We envision a congressional caucus-style table, maybe something on the state and local level as well. And then how do we bring the public along on this journey so that we have their buy-in? It's not just a top-down, here's what federal legislators say is going to save democracy. Just a bit about the people we've been speaking with. It's a very rich list of interviewees. Former elected officials, legislators, and their staffers, so people with practical understanding and experience moving things through Congress, political and issue campaigners, civic groups, civil rights groups, and nonprofits, policy think tanks, leaders in faith-based communities and in industry, and of course, academics who've been looking at this issue for decades. We're asking questions around what challenges do they feel are most pressing, both in the immediate and the long term, that are impeding our efforts to strengthen democracy. What opportunities do they see that are ripe for bipartisanship and collaboration? And what can we learn from other efforts? There are plenty of great organizations working in this space. Bipartisan Policy Center, Issue One and More Perfect. What can we learn from previous efforts that we can really channel into this moment and this deadline that we're striving towards, the 250th? And I'm happy to kind of give you a bit of a preview of some of what we're hearing. maybe nothing will be super surprising, but maybe inspire a little bit of hope, because even amongst the skeptics, we did get some specific ideas of what this bill and this collaborative problem-solving effort could really focus on. So there may be some previously missed opportunities that we can revisit around elections, specifically funding. Elections are deeply underfunded. I was shocked to hear of the difference from county to county and state to state in terms of how much is spent per voter. Also around administration and protections for election workers. I think Mary Jo from NACO mentioned how so many election directors are getting fired due to or stepping down to the harassment that they're receiving. And also even more fundamentally, collectively understanding and exploring where do these sources of distrust of elections come from, and what can we do with that understanding. Also civic education, state and local level, and not just K through 12, but also making sure adults aren't forgotten. Maybe something that's actually a little less policy oriented, but very much important for Congress people, but shifting norms and practices around how Congress governs. So could there be a collective agreement around the shift to a chamber procedure, or something that inspires more collective action? We're even seeing some of this on the state level, so the modeling of constructive dialogue with the Disagree Better initiative, Governor Cox in Utah, Governor Polis in Colorado, so there's some hope there, and clearly some appetite. Some of our future caucus participants here today show that people do want this, even if they're skeptical about what can be done in a polarized and divisive environment. Just a few other examples, maybe something under a national service banner, supporting local news, social media regulation, and then also interestingly, thinking through what this would look like if we go a federal trajectory, and then what would it look like if we went state, in a purple state, in a red state, in a blue state. Ideally, we land on something that's flexible enough across these levels. And I'll maybe leave you with this because it can help inform the discussion later. And there's this running joke that Gideon and I are going to solve democracy, but really you've got to be given 20 minutes to help us solve democracy, so it's going to be on you. But the word democracy has become a charged term, and it's also variably defined. So some people define it very minimally, very narrow definition. So it's a set of negative rights, it's voting, and it's elections. There are people who define it more broadly, beyond voting. So civic engagement, participatory democracy. How can people be more involved with their democratic institutions? So I will leave you with that. Hopefully it's a bit of a flavor of what is coming out of our research process and our partnership with Issue One and More Perfect. And I'll hand it back to Gideon to set us up with the questions for discussion today. 20 minutes to solve democracy, I'll go.
Before we get to those questions, I just want to emphasize, as Monica did, that Issue One's focus is on finding the ideas that can go into bipartisan bills, but also just the process of making the case that democracy does not have to be partisan, and that especially with a broad definition of democracy, that there is an area where legislators in both parties can agree on these issues, and trying to broaden that space is part of the goal. My goal is always to pass legislation, but if we fall slightly short of passing legislation, changing how people see democracy and seeing it as an area for bipartisan agreement I wouldn't say an okay, but it's something I'd be happy with as well. But again, still passing the bills the main focus. Okay, so you are hopefully at different tables with different people, making new friends. And we have two questions that we're charging you with, and I think we're going to put them up on the board as well, so you don't have to remember them immediately. But first question is, what do you, or the audiences and communities that you work with, see as the most pressing challenges facing efforts to strengthen democracy in the U.S. today? So what are the most pressing challenges facing efforts to strengthen democracy? And then the second question, what actions would you like to see policymakers take to strengthen civic life and democracy? And I think we just lost that part. So, go.
Mutual friends. And so, there's a way in which speaking to you all, although I've never been to this gathering before, it's a little bit like playing at home in baseball terms. But Braver Angels, we're a membership organization, primarily grassroots, that nevertheless does do work at every level of government, with programs unfolding with some of our shared friends in the Select Committee for the Modernization of Congress, the Problem Solvers Caucus, work being done in state legislatures and municipal governments and even school boards across the country. We have a presence on college campuses across America, working with organizations like Bridge USA and the American Council for Trustees and Alumni. About 100 or so bipartisan alliances. You think of them as local chapters, but we refer to them as alliances, dotting geographic communities across the map, a singer-songwriter community, a couple hundred artists and musicians strong, using art and music, in addition to theater and comedy for that matter, as tools for bridging the divide in ways that can transcend sometimes mere dialogue and debate. But of course, we have programs oriented around debate, dialogue, discussion to help strengthen individual civic muscles in the American person, right? There's work that we do along the lines of helping people to escape stereotypical thinking about the way we internally think about each other. We have workshops oriented around the art of interpersonal empathetic communication, all of these different things. But what it amounts to is an approach to polarization in America that tries to recognize these two axes of our divisions. Because on one hand, there is a broad-based narrative of division in American society, whereby we are occupying these parallel storylines of left and right? They deliver us in different universes of information. And this leaves us in a position to where we suddenly can't get along with our neighbors the way we used to. We suddenly can't hold conversations at the dinner table the way we might have in time past. And yet at the same time, the polarization, the division is vertical because we have lost confidence in our institutions, from Congress to the universities, corporations, the major parties, certainly the political media, and even the church and the military. All have seen declines in the confidence that the American people have in that direction. So on top of all of these things, now this is a landscape of divisions exacerbated by bad incentives in the business models of major American institutions, coupled with an evolution in the technological landscape that has taken real and organic divisions and has artificially amplified it in ways that go beyond what the problem might have looked like in the absence of social media, in the absence of a 24-hour news cycle, and the absence of a business model reflective of both the political parties and the media, that whereas once the parties and the media used to seek to speak to the broadest cross-section of the American people, think back on the halcyon days of Walter Cronkite, think back to John F. Kennedy and Richard Nixon, where in the first ever presidential televised debate, Richard Nixon said of John Kennedy, he said that the difference we have between us, I'm paraphrasing, but the differences we have between us today that you will hear us debate about are differences of approach. They are differences of method. But where there is no difference between my opponent and I, is in our allegiance to this country and our ultimate desire to see what is best be done for the American people. Again, I'm very roughly paraphrasing, but this was a period of time in which the parties sought actively to speak to the broadest cross-section of the American people and signal a greater cross-partisan allegiance to the idea of America itself. Those days seem to be well behind us now. And yet, underlying even these trends are age-old tensions arising out of America's very complicated racial and class history that in many respects find themselves exploding out into the open in a moment in time where the stability of our institutions and the larger common ground that is at least articulable across this expanse of the American people in our politics and our institutions seems to have dwindled. And so how do we understand and then how do we approach these stacked areas of division in a way that strategically apprehends the complexity of the moment that we're in? Let me just say this really quickly. No matter who wins the 2024 election, we're all going to live next to each other tomorrow. That's the goal. That's the idea, right? We cannot head off all of the challenging things that are going to come bearing down on us in this election cycle and in the time to follow. But success in this project must be measured in part by our ability to set the stage for a coexistence rooted in a deeper empathy and a deeper respect between the American people, one that can stabilize the functioning of our institutions. How can we do that if we do not find within ourselves the capacity to deeply empathize with the experiences that have radicalized so many of us in American politics, to the point in which we willfully empower some of the most divisive forces in our political society? So I do want to tackle the racial and class dynamic of polarization as a means of achieving clarity on that question. So again, I am a biracial American. Mother's black, dad's white. Father's family is from the South. In American history, there is this reality that many of us will be sensitive to, that people of color, well, African Americans most particularly in this telling, have found ourselves moving from one chapter of marginalization to another in the larger context of the American story. From slavery to the brief era of Reconstruction, to a period of time in which Black Americans were wantonly terrorized by the forces of the Ku Klux Klan, the redemptionist movements in the White South, to a large scope of time in which Jim Crow segregation in the South, but also the segregation of housing, of communities in the North and in the West, left people of color in a long arc of marginalization over which a glittering daybreak of social equality seemed to emerge with the victories of the civil rights movement. But following this, wound up encountering a reality in which poverty remained severe, economic opportunities were exported with the loss of manufacturing jobs overseas, the loss of agricultural and service sector opportunities domestically, in part as consequence of shifts in immigration policy. Many conservatives would argue, and I would have some sympathy to the statement which says that certain advances in the welfare state, while they were effective in ameliorating hunger in American society, did not necessarily contribute to economic mobility in American society. And on top of all of these factors, you have the advent of heroin, of crack cocaine, the rise of inner city gangs, the mass incarceration response of law enforcement, which sets the stage for an American society in which, by the time I was 5, 6 years old, living as a kid in Los Angeles, in a suburban household in which I, as a young Black American, was generally untouched by the violence of the LA riots, my wife, who was the same age, 15 minutes and 15 miles away, found herself lying on the floor to avoid gunfire, to hear the sirens blaring in the background of that calamitous moment, looking on TV and seeing officers beating a person of her skin color and hearing the people around her describe themselves as living underneath police occupation in the midst of an actual American war zone. This is 1992. And so I asked the question for many people. I say, and over the course of this long history, when does the American dream actually show up for disproportionately many African Americans? And many of us will be sensitive to that perspective, the perspective that led to, in part, the populist uprisings, the demonstrations in the streets that we saw with the advent of the Black Lives Matter movement. Many of us are much less sensitive to or knowledgeable of a larger history of struggle with respect to poor white Americans in this country. Many of us don't know too much about the fact that in the early days of colonial America, poor English children were scraped off the streets of London to be sent to the colonies as laborers and indentured servants by companies that sought to establish for themselves an empire of economic reach and land acquisition. Many people are not familiar with the hardships experienced by people called crackers and squatters, later on rednecks and white trash as they populated the frontier west, the rural south. Many of us don't think too much about the fact that within the inherited memory of Southerners today, there are still stories about General Sherman's march through the South, a culture in which patrician slave owners sent poor white people to be cannon fodder for their slaveholding interests. And over the course of time in a country in which rural poverty in Appalachia, the rural South, in poverty ensconced in different parts of the Rust Belt as time proceeds, has seen a white experience in America in which, yes, as a straight across matter of comparison, it has historically been better to be white than black in America in terms of your material opportunities. Nevertheless, there are groups of white Americans across the South in rural places, again in Appalachia and elsewhere, who trace a long history in this country in which the American dream has never come to them. And it is to those Americans that Donald Trump has arisen and said, I see you, I will fight for you because the elite institutions in your society do not care about you, they never have. They say that you have white privilege, but what you really have is a pale marginalization. And now you are not the favored sons of this country, but in this movement that I am leading, I will represent and fight for you. Suddenly, we have a landscape of social, ethnic, and cultural relationships in American society in which we are again pitted against each other along tribal lines with the interests of poor people who, whether it is African Americans in our inner cities, who listen to out-of-touch conservative elites say that, well, if only you would get off of your bed and stop shooting each other and get married, all of our problems, our social inequality will be solved. Or whether it's folks who you might think of as white trash or rednecks or hillbillies listening to cultural elites on our university campuses bemoan the fact that they don't recognize their white privilege and rather should see beyond their own poverties and struggles to recognize the injustices of American society as they pertain to other people. We find ourselves in a landscape in which we are experiencing a deep dearth of empathy for the struggles of the American people in all directions. Because we have divided our climate in a way to where if I'm on the left, I can only empathize with certain people. If I'm on the right, I can only empathize with certain people. And in a climate such as that, reconciliation is hardly possible. Martin Luther King Jr., however, died in an effort to bring together these very groups of people, these very groups of Americans. He died in the process of leading a Poor People's Campaign, 1967 and 1968, which sought to make common cause between African Americans who were victims of Jim Crow segregation, but also poverty in the urban North, along with white people in Appalachia and the rural South who themselves were disenfranchised from genuine economic opportunity and social mobility in American society, whose prejudices and ignorances may have been weaponized by powerful parties and figures in the history of American politics and in the history of the region, but whose ultimate interests, Dr. King believed, were materially aligned with the interests of people of color in America, but more than that, who are themselves made in the image of God and deserving of deep human dignity in a culture of politics that Dr. King wished would recognize the fact that there is no genuine democracy of the sort we would like to see in American society without there being a culture of genuine inclusion, which extends across the color line and across the class line. You don't hear people talk about politics like that very much. You don't hear people talk about race like that very much. You don't hear people talk about class like that very much. Because when you look at it in one unifying frame, not striving to gloss over the particular differences of experiences and conditions that exist between these people. But when you look at the problem we're facing as a larger and greater problem of marginalizing and tuning out the experiences, the lived experiences of Americans across, again, this color spectrum, but oftentimes deeply rooted in a lack of access to the greater heights of the American dream, when you look at it in that way, suddenly it's not clear what side can benefit from that narrative, but it does become clear how we might come together to make a better democracy and to make a better country. And that's the way we ought to begin to appreciate how it is we might talk about race and class in America. Because part of what we're seeing is an eruption of resentment against the institutions of our society. Now, it's an interesting thing, because at the same time, part of what this highlights is a deep convergence of values from left and right that proves the fact that the liberal norms that historically have undergirded a post-war period in the aftermath of World War II, in which American institutions, I would argue, were strong, and that I think reflects the general consensus of values of Americans right, left, and center to this day. It highlights the fact that those values really have been triumphant in the longer arc of our history. Francis Fukuyama wrote a book called The End of History, essentially arguing that the liberal democratic experiment had won. It was clear that liberal values based in reason, liberty of speech, a commitment to intellectual inquiry, and these sorts of values had generated a democratic society and norms of democracy internationally that showed the way forward for the global order in the aftermath of the fall of the Berlin Wall, the fall of the Soviet Union. And those are exactly the sorts of values that a candidate like Vivek Ramaswamy, interestingly enough, tries to speak to today. And here Vivek, when he was on the campaign trail, would very much sort of drive home this idea of, well, we have to unite America, and this is how. We need to unite America behind the radicalism of the American experiment, because it was radical in 1776 to say that we want a society in which everybody is free to speak their mind. It's gross simplification of history, obviously. But Ramaswamy was attempting to speak to a potential political majority in American society that still believes in free speech, that still believes in open inquiry, that still believes in the project of self-governance, and that has an antipathy towards any and all forms of authoritarianism. And the majority is still there. But if you rewind the clock, and if you remember what allowed for the stability of the bipartisan mainstream in the post-World War II years in American society to hold as steadfastly as it did, it was in part owing to the fact that the two parties, while it is true that the American people and the politicians themselves were not divided against each other on the basis of partisan affiliation, nevertheless tended to be united in a status quo that did not allow for a conspicuous surfacing of the complaints and grievances of African Americans specifically, but many poor people generally in American society. And so those suppressed social grievances spilled out into the open in the 1960s, which we'll remember saw not just the birth of the mainstream civil rights movement as we remember it, but also the rise of the conservative movement, the rise of Barry Goldwater, and later on, of course, maturing into the movement of Ronald Reagan, which was not the populist movement of Donald Trump, but which did speak to the disparaged values of felt marginalized by the American mainstream and, quote, more or less, ignored that mainstream just as surely as they were ignored, taking the time to build out their own institutions of media, their own social environments and political ways of speaking that had nothing to do with America's mainstream institutions, setting the stage for a lot of the deeper divisions that would follow. There's a consequence for not hearing the American people in their suffering, in their struggles, in their aspirations, and there's also consequences to exploiting the grievances and the suffering of the American people for narrow partisan ends. But we can change that perverse paradigm in the work that we are doing in grassroots communities and in institutions. Part of what we have to prove today within our institutions is our own capacity to transcend the divisions that exist within the structures of our electoral system, of our college campuses, of government at every level, the media potentially, and even the churches, so as to show the American people that there are ways of doing business with each other in a free society that rest on the firm foundations of relationships of trust that we invest in a spirit of goodwill, which allows us to absorb our differences of opinions, recontextualize them in a way that says, yes, we do disagree on things, we will inevitably disagree on many things, but where there are areas in which our values and our interests converge, we can make progress and do so in a way that shows the American people that our institutions can function in a time of polarization. Convergence does this work, not just in governing bodies, but in corporations and non-governmental organizations and institutions. It is a model for how it is we might be able to engage the deep ideological tensions that divide the American people and show the American people that our institutions may continue to function, to do the work that they are set up to do. At the same time, there is a larger cultural conversation. We are in the midst of what people refer to endlessly as the culture wars. And the problem with that phrase, or at least the scary thing about this phrase, is the idea that our cultural differences between each other could represent something like a zero-sum reality to our very existence as Americans sharing a country and sharing communities together. But there's a way to transcend the culture wars too. I hearken back to Martin Luther King Jr.'s philosophy of nonviolence. Many of us remember Dr. King as an activist, but we don't remember him as a moral philosopher. We don't remember him as somebody who had an overarching and deeply fleshed out moral and ethical and spiritual worldview. But it was based on this idea of agape love. And what Dr. King believed was that agape love was a spiritual force that could affect social transformation. He believed in this idea that by embodying agape love, which you can translate to goodwill, right? So in other words, not a love of affection necessarily, not a love of friendship. It's hard to be affectionate or friendly with somebody who might be actively persecuting you, actively marginalizing you, or just acting like an asshole. You know? But Dr. King believed in this idea of agape love, goodwill, that when you embody goodwill in your behavior and the way in which you speak to and engage with your opponents and your adversaries, you have within you the ability to maximize your opportunity to speak to the conscience of that individual or those groups of individuals, such that even if you are not able to persuade them to change their mind in a given moment, you might be able to show them that you are not truly their enemy and therefore create social, psychological, and emotional permission for us to listen to each other, even in the midst of our most heated debates. Dr. King said that what we seek is the beloved community. What we seek is not to defeat or humiliate the opponent, not to defeat or humiliate the white man, but to be reconciled to each other in friendship and understanding. That's the vision of the beloved community. A vision that transcends party, that transcends ideology, but that doesn't gloss over the deep and meaningful differences that we have to work through in those spaces, in the service of raising up a formidably empathetic democracy. This spirit of goodwill and agape love for our neighbors is what we seek to instantiate in the methodological design of our work at Brave Rangers. But I also have a hope that it can be the animating spirit for a larger civic renewal movement in this country, a larger bridging movement in America that bases its hope for a brighter tomorrow not merely on our ability to stabilize the mechanical functioning of our institutions, although that is vital and itself rests on our ability to be in relationship to each other, but that also seeks to achieve a deeper level of empathy, understanding, and a compassion between Americans across our ideological and cultural divides, but in recognition of the human struggles of our experiences in the larger history of this country. Americans have suffered in many different ways over the long arc of the history of the United States. Some of us, black, white, liberal, conservative, and elsewise, have done very well and have lived out the fuller promise of the American dream. I am very much one of those people. I tell people I grew up. People who say to me, John, you will never see this promised land. I tell people I grew up in Dr. King's promised land. For one, my grandparents were white Southerners, and they were not necessarily enthusiastic about the idea of my father marrying a black woman. But by the time me and my brother were old enough to have any relationship with them, they loved us more than anything in this world. A similar cultural shift took place across much of the Old South, turning it into the New South. It's not to say that the deep problems that we can all mention didn't persist and survive, but cultural evolution towards a deep-seated goodwill that transcended race was real as a consequence of the efforts of that moral movement. I grew up in a progressive community on the West Coast in which racial and ethnic diversity was very much celebrated, where I didn't have to feel like I didn't belong because I was a mixed kid or because I was a minority, right? These are deep markers of progress in American society. The language of privilege is much loaded. I tend to not want to overload it, but I will say that I am very much privileged to be an American. Not just because of my material opportunity, but because of the lessons of the history that runs behind me and behind all of us. And if we can hearken back to the higher teachings and traditions that we can find in that history, in the context of the civil rights movement and other epochs of our experience, if we can look with an empathetic and compassionate eye at those who feel radicalized in today's America because they never felt heard in yesterday's America, then we might be able to set in motion a cultural change in tone that is not generic, that is not superficial, that does not hang above the surface, but actually gets to the heart of people's pain and shows that there's nevertheless a pathway for them to be able to relate to their neighbors and make progress on the things that matter. We can demonstrate that that approach works in the work that we do within institutions and in the ways in which we choose to engage our neighbors in grassroots America and in local communities. This is a little bit of a challenging speech, and I appreciate you all giving me the opportunity to deliver it. In full honesty, I've spent my entire life observing American politics, partisan politics, racial politics, so on and so forth. I think I always felt a deep and bitter contrast between the hopefulness for America and the realization of our higher ideals that I felt like I was experiencing day to day in my own life, in my own family, in my own community, in contrast with the pessimism for America's future on the partisan front, on the racial front, that I even remember back in the 1990s, and that was exacerbated and accelerated through George W. Bush, through Barack Obama and the Tea Party, despite the triumphant moment of Barack Obama's election. And now here we stand in the era of Donald Trump, Joe Biden, the election of 2024, an election in which we can pretty safely anticipate millions and millions of Americans will not see legitimacy in the outcome. And yet, it is within us to tell a different story with respect to who we are as a people, how it is a deeper commitment to goodwill still has the power to transcend the divide, that can enable us to hold this country together, to show that its institutions can still work in the face of adversity, regardless of what happens on election day, regardless of whether we come away from it with a President Biden or President Trump. That is a very important detail. It is a very important question, but there's another way in which it scarcely matters at all. Because American society has to evolve, it has to move forward. But we cannot move forward unless we hearken back to the values, to the teachings, to the experiences that anchored us in the better angels of our nature in times past, and use those lessons to invest in the project of civic renewal in the moment we are in right now. I am honored to be in this broader work of civic renewal with each of you. I am honored and deeply pleased and privileged to be a part of the work of partisan bridge building with each of you. The project of rehabilitating our institutions. And I believe that if each of us in this room believes in our power and capacity to achieve a spiritual transformation in the heart and conscience of the American people, that we will find that the gravity and momentum of history moves towards reconciliation, whatever the pundits may say. And so with that, I thank you very much for giving me an opportunity to speak to you today, and I'm more than happy to take any questions. Thank you very much.
My initial thought was like, I was a Jew who was just taken to church, and I really liked it. So, my question for you is, and it happens to be personally relevant to me, but I think it's relevant to the whole room, is I've been working in healthy democracy, nonpartisan space for the past 10 years, and I'm about to move into a position that's outwardly center-left.
Yeah.
And I have to say, I'm very nervous about the transition of re-embracing my partisan side and beliefs without abandoning the principles that are overarch all of this work. And I think it seems like you're someone who does this, right? You ran for Congress as a Republican, which probably you get a lot of shocked looks from, as you acknowledged. And now you're an ambassador for Braver Angels without sort of ignoring that piece of your past. And I'm wondering if you can give any advice about how to embrace your ideological standpoint, but still hold space for the other side, and also make it clear that you're part of this movement toward moderation and reconciliation.
Right. Thank you for the question, and it is a very good question. I see the project of civic renewal in America as always operating upon two tracks simultaneously. And these tracks exist in tension with each other. On the one hand, as Americans who, each of us individually, all have our political beliefs, convictions, perhaps affiliations with or allegiance to a political party, we do have an obligation to represent and to fight for the things that we believe in terms of the policy direction of the United States of America, in terms of political direction of the United States of America. And that is a fight that is bound to the election cycle. It is bound up in debates over pending pieces of legislation and all the rest. But at the same time, we have to hold that in tension with, and so that's the competitive track. But then we have to hold that in tension with the cooperative track, the track of community building, in which the way we pursue the things that we believe in politics nevertheless gives voice to a spirit of interpersonal and intergroup regard. Again, a spirit of goodwill towards others that dignifies the differences we have between us, even as we do not shrink from the political fight that inevitably has to unfold in the context of democratic society. You can show love and understanding to people who think differently than you, while still making clear your own partisan convictions and ideological preferences. You can do it in a way that says that while the things I believe in politics are important and important to me, it's not necessarily more important than my showing dignity and respect to you, empathy and love for you as a leader. If we can do these two things at the same time, we can anchor this larger movement on firm footing and hold ourselves with integrity in any of our positions in the civic landscape, as we seek to be a positive part of this movement while still holding true to the values we hold dear in politics.
Good afternoon, John Thank you again for an inspiring speech. I was able to dial into the conference and over the summer. Really enjoyed everything Brave Ranch has been able to do. The tension, the challenge I see in some of the overall architecture, I echo the church comment. Very, very inspiring. Lots of appeal to moral suasion. We should. There's also lots and lots of engines inside technology and elsewhere that drives at segmentation, agitation, catalyzation, all those sorts of things. Walk through where you see those trench lines, because the information age is sort of one accelerating, and where I feel like the preacher on the sidewalk, like, no, slow down, be nicer. Like, how do you see those two things playing out? And or can you comment on where you see the deconfliction of these deeply held beliefs occurring?
Well, okay, yeah. Let me try and wrap
make
all
that
of
complex.
that. No, it's very good. Let me try and wrap all of that up into a somewhat efficient overview of some fairly complicated things. But I do think that there is a bit of a if this movement is going to succeed in the way that it could and can, activities aimed at raising the culture as it exists within our individual institutions and our culture writ large have to be they have to be intentionally synchronized in a sense. That doesn't require a sort of command and control function, but that does require us being in relationship to each other as different organizations and the work that we do in different spaces. The basic model of Braver Angels, because we work across a range of institutions, but don't go quite as deep in certain individual institutions as Convergence does and other groups do. But what we try to do is essentially baptize people through experiences meant to build up their civic muscles, build up their larger capacity for empathy, give them tools and tactics for being able to essentially cross-pollinate those norms across the landscape of American institutions, government, education, media, local communities. In so doing, creating a virtuous cycle in which this narrative of reconciliation, leading people towards actual experiences of relationship building, equips them with tools that they can take back with them to their corporation, back with them to their city council, back with them to their college campus or their local government or their kitchen table, and that in turn becomes an engine for the building up of goodwill across sectors and across communities. There needs to be a virtuous cycle that ties these experiences together, because otherwise it doesn't scale. That's always the question we're getting hit with. How does the work scale? And it doesn't if it's just a matter of a single workshop. But if the workshops and the media work that we do, and I'm not just talking about Brave Rangers, I'm talking about the larger bridging movement here, if the work that we do in terms of point of contact experiences and storytelling is rather, instead of a one-off endpoint, a funnel to a deeper and more immersive process that channels these energies throughout the landscape of our institutions and our communities, well, if we can just get traction behind that engine, it can begin to make an impact that swells, right? But to your point about technology specifically, the technological sector needs to be a part of that. There needs to be a strategic vision for how it is we might be able to impact the culture of digital design in America in a way that interrupts its tendency to reinforce the polarizing instincts that are destabilizing the body politic, broadly speaking. And I'm afraid that I don't think any of us are too far along in that direction as of yet. Brave Rangers does have a relationship with the Center for Humane Technology. I'm sure you're probably familiar with Tristan Harris, and others will be as well, who's very much committed to reforming the culture of digital design in Silicon Valley so that it is not antisocial and destructive, but actually rewards content creators and platforms for designing structures in a way that brings people into relationship with each other in a way that is socially positive. The idea was to take some of the learnings and principles developed in groups like Brave Angels and other depolarization and peacekeeping organizations and apply that to the culture of digital design. As of now, though, that work is fairly nascent. All of this work is still relatively nascent. But we need to start imagining and vision casting in that direction now, because the momentum of technology and the direction of social dissolution is massive. And we do need to at least have a vision for how we might interrupt it. Okay.
I'll just ask one quick question. I guess she handed me the mic, unless you need to hand. I know.
I got one more. I don't know if
I'm just going to put in a plug for Braver Angels. I think you're the Braver Angels. That's a membership organization where you bring blues and reds together. And I'll just say, for the last comment, we're in counties in Minnesota. We bring in Braver Angels all the time, but we don't like to identify blue or red. So we identify by geography, by different things. But we do come together to talk. Love Braver Angels. Love the work that you do. It's a membership organization. Go online and sign up to be a member, and you'll get all this great information, and you can hopefully go to some sessions. And we've had Braver Angels at NACO as well, and we're bringing it to all of our groups. So just thank you so much for your... And Bill Doherty is a good friend of ours from Minnesota, and he lives in my building, but we love him. But anyway.
We love Minnesota. Thank you very much. Thank you all.
I think you hit the nail on the mark. It was so inspiring to just hear how much power there is in each of us as individuals to embrace this goodwill towards each other and what a difference that can make. So we're going to move on to our last session of the day, where you'll hear from the same folks that you heard from to kick off the day, Mariah and Rob. But before they go, I'm going to ask Roxy to share a little bit about the book that she's had the opportunity to read and weigh in on before turning it over to Rob and Mariah.
So I guess I have to go really fast, right?
True.
Yeah, true. I follow orders, Mariah. You're the CEO.
And president.
And president.
She didn't do it when I was president.
How many of you met Rob in either a train, a car, a plane, on the beach? Just raise your hand. How many of you met Rob in some moving vehicle? Yeah? Well, at least two. I think the rest of you are lying, but okay. So I met Rob in 2008, and at the Omega Institute, and you'll have to ask him this story about the spitting shaman and the ice cream cone. But at any rate, that's when we were at a leadership seminar for a week, and I saw the seed of convergence being planted firmly in Rob's mind, and then the vision began to sprout. And of course, 15 years later, it's bloomed. So, you know, I've been hanging out with this dude since 2008, and I still like having to hang out with him. So let's give Rob a hand for sticking around all these years. So I have some notes here. I don't want to miss anything because I'm sure you want to hear it all. Then and even now, what convergence was offering the world was understood by too few and used too often, or used by even fewer people, right? You agree? 15 years ago? Yep. We weren't talking about this stuff. It was, this was a brilliant vision. And Rob somehow convinced a whole lot of us that it was a good idea, and he was right. What Rob and Mariah have masterfully accomplished, and this was no little deal. I mean, right?
It's a lot of work to write a book.
It's a lot of...
Who knew?
Yes, I knew. What they've masterfully accomplished in writing this book is to let the world know about our secret sauce. And it was too much of a secret. And so what I think is miraculous about this is that they've done it in a way that we can all understand. And what's more, the world can understand it, and leaders can understand it, and it's like a step-by-step process that makes so much sense. I mean, I was like, how come I never knew all of this before? And truly, if you have any questions about how the convergence process works, buy this book and tell everybody to buy this book, because we have to spread the word. Somebody earlier talked about the butterfly effect, right? Well, this book can go a long way to spread a lot of butterfly wings. So I just hope you want to say that. to everybody you know. Mariah and Rob make it clear that collaborative problem solving isn't about making nice or death by consensus, right? It just isn't. It's about trying to put the right people in the room, talking about the right things that are important to our world and making our world a better place. And if we've gotten nothing else out of today, we all know how important it is to the people in this room and to people all over the country and all over the world to make this world a better place. We got big problems. And let's get together and solve them using their process that they've so beautifully identified. So I was taken, truly, when I first read it, and Rob asked me to read it, by how gracefully they guide us step by step through this process. All of us here know how wise and smart Rob and Mariah are, right? Right? Right. Thank you. A little, I know you're tired, okay? Now everyone who buys, did you hear me say buys, and reads the book will have the benefit of their wisdom. So I am just incredibly honored to be one of the first people to acknowledge your incredible accomplishment.
Thank you, Roxy. Is this on? Can people hear me? It's my turn, right?
Your turn.
Thank you.
Hold it close to you.
Yeah, so first of all, gentlemen, thank you for your beautiful remarks, inspiring remarks. And I'd like to say, I think our book is intended to help create the kind of world and the kind of changes you prescribe. And we're part of a much larger movement. Thank God there are many, many groups working on this. I'd also say, from my experience, and
Your mic's not on.
Your mic's not on.
It is on.
Yes, it is. From my experience, well, maybe I'll sing a few numbers. From my experience, in addition to all the other bridging work that goes on, the level of connection and impact on how people see each other when they actually do something together and problem solve runs very deep, and it has an indelible impact on their lives. I'd point out that right now on the Convergence board are 4 people who were participants, stakeholders at our table, and I think so moved by their experience that they want to be part of something larger. So that's part of what we want to do. The other thing I want to mention just at the outset before I say what I was assigned to say is I want to introduce our friend Cliff Hendler right here. And Cliff and I are old friends, and his son Micah, who's been to meetings here, is the director of the Jerusalem Youth Chorus. Now, this is my tendency, I choke up when I get moved by things. A week ago, I went to hear the Jerusalem Youth Chorus sing at a local synagogue. There were Palestinian youth and Jewish youth from Israel, and despite the circumstances they live under, they not only sang together, but spoke of their love and affection for each other. And they spoke of the need to create a new reality. A reality that was not based upon hate and intolerance. They openly disagreed about what ought to be done about the current situation, but they were creating a new reality. And that's what we're about here. We're about creating a new reality where people become so resigned and so discouraged and so dispirited about our ability to get along. And in many ways, it's such a false premise. And everyday people, especially heard Mary Jo speak at the local level, I think people are much more successful. But we want to be part of shifting that culture back and calling people back to the norms and values they were raised with, that all the major religions and spiritual leaders call for, and that's what this book is about. It's meant to be very concrete. It's supposed to bring home how it is that people can not only get along better, there's a lot about just getting along, but then how they can go further and problem solve together. So I hope you will take an interest in the book. I like to joke that it's mainly a nonfiction book. And I like to also joke that now that Meryl Streep has agreed to play me in the movie, I hope the book's really going to take off. Let me just say a few other words about the book and then turn it over to Mariah who'll give you a little more background. The book, are we handing out flyers about the book?
We have flyers at the back of the room, and this QR code on everyone's agenda goes to a page that brings you to the book.
So the book, surprisingly, is called From Conflict to Convergence, Coming Together to Solve Tough Problems. It's coming out July 30th from Wiley. Pre-orders are widely available, and you'll get that. You'll see that on the blurb, and thank you for the pitch, Roxy. And we hope people will not only buy it themselves, but share it with others and go to your networks and encourage people to do so. We've been told by the publisher that even a couple thousand pre-orders at this point begins to create notice for a nonfiction book, and can create a buzz, and we hope reviews and a virtuous cycle. We've written the book, though, to be evergreen. It's not about this year, it's not about politics, it's not about Donald Trump. It's all about lasting values about how we can come together to solve problems more effectively. And in that process, not only do we solve problems, but we build bonds of friendship. And I love the phrase that Gene Molinos gave us 15 years ago, create the radiating impacts of having people talk to each other, work together differently over time. So we wrote the book not just for political leaders, although our experience was federal, state, and local, but for academic leaders and for students who can't get along on campus, and for business leaders, and for nonprofit leaders, and philanthropic leaders, and for just ordinary citizens who want to take hope that we actually can turn this country around to the point where we get along better and work together more effectively. So it's a wide range of people who we're trying to reach through this book, and we hope that people will take it for what it means for them, whether it's solving a problem in their family, or solving a problem in their community, or their business, or a nonprofit. We believe, and we have many affirmations from people who have read the book, that it could make a marked difference in people's ability to work together across differences in all these settings. So I think that's about everything I was asked to cover. Was there anything else you wanted me to do?
No.
Turn it over to you, Mariah.
That's great. I think for me, the biggest motivation for writing the book is that I've had the honor to get to do this work for my whole career, and I've sat in so many different rooms and worked on so many different issues. And I wouldn't say it's easy, but it reliably leads to people building trust and coming up with solutions that they can all get behind and buy into. And I want more people to know that, because folks are giving up hope and thinking that we can't do that, and we know that we can. So that's why I'm excited to have been able to work with Rob to write the book. So I'm just going to say a couple of quick words about what you can find in the book so that you know. So we try to ground the whole things in stories. So we tell stories like the ones you have heard here today, as well as stories that many of you in the room shared with us about conflict at the organizational level, conflicts that I worked on at the state and local government level, probably things I did with the Association of Minnesota Counties. So we try to tell stories that lots of folks can relate to. And we try to break things down in a way that lots of folks can relate to as well. So we start out by talking about mindsets, because those are the attitudes and beliefs that shape our actions. And so when we're trying to change the way we do things, we need to think about our mindsets. So we talk about things like mindset of giving everyone the benefit of the doubt, which John talked about really beautifully, that very few people wake up in the morning thinking about how can I make the world a worse place today, and if we can understand why the thing that they're doing makes as much sense to them as the thing that we're doing, we're going to go a lot farther in developing relationships and finding higher ground, which are other aspects of the mindsets that we talk about. We also talk about building blocks, because as you heard today, convergence's processes are pretty long and complex. We know not everyone needs to or is going to do that. So we wanted to give people building blocks that they can use in their own settings. So things like going slow and building trust first, whatever level of process you're engaging in. And then we do lay out the whole process that we use at Convergence. And we make a bit of a pitch to say that the whole is more than the sum of the parts, that I have found that doing all these process steps is really helpful, but folks don't have to do them nearly as extensively as we do at Convergence. So we do give folks a sense of all of the process steps, especially how do you generate those shared principles and visions that you heard folks talk about throughout the day to develop those really creative and impactful higher ground solutions. We also help folks practice throughout the book. So we use these try it outs to help folks try to apply this to real world issues, and we filter skills and evidence and science behind the work throughout the book. So that's a very quick overview of what one can find in the book.
Yeah, I guess I'll just conclude, and then we're going to open to the floor. There are stories in here. One was actually pre-convergence, and Ron Pollack and Stuart Butler are part of that. We tell the story of a healthcare coverage for the uninsured project that helped lead to major legislation in the early 2000s in this country to help cover the nearly 50 million Americans who weren't covered. We talk about our Reentry Ready project, which people will recall. We had people across the spectrum, tough on crime and not tough on crime so much. People in private prisons and people who hated private prisons coming together to put out a blueprint on how we can do a better job helping people thrive when they get out of incarceration. We talk about our long-term care project. We also talk a lot about our K through 12 education project, which is one of the major successes, and the role of Becky Pringle, who's endorsed the book, who's now the president of NEA, and Giselle Huff, who famously was one of the nation's leading critics of teachers' unions, going out on speaking engagements and together on a shared vision. So it's meant to be engaging, story-driven, to illustrate the points and to bring people in so they can understand it and bring it home. So with that, since we have limited time, and we have to make some final remarks and pitches to you, we wanted to open to the floor, ask just popcorn style from the floor. Would love to have you involved in getting the word out about the book as you feel comfortable. Again, we think if we can get a critical mass of readership, we can contribute to the tipping point of more and more people who think this way, who want to become collaborative in their own lives, who want to be collaborative leaders. In my view, I hope they will then vote for collaborative leaders, because you will find through this book that collaborative leadership is not soft, it's not naive. It actually gets things done in a way that leads to unprecedented results in terms of the wisdom of what comes out, but also changes the relationships of people over time. So we would love to ask you to contribute ideas to, do you have networks, how can you go out to your networks to encourage people to look at the book? Do you know people who run podcasts? Are there speaking engagements or radio and TV appearances where we could go? We are going to do some travel. We don't have an unlimited budget. Are there places we should go, or are some of you willing to host events where we might put the word out about the book and so on? Are there any other examples of things we want to?
The launch team.
And we want to create a launch team, which was an idea we just learned about from Wiley, the publisher. So we're going to look for volunteers, for people who might work with our staff and with us, who might be just willing to be part of a team for an occasional check-in and phone call about how do we elevate and create real momentum around the book so that people begin to take an interest and begin to apply these ideas into their lives. I see Akif. He's got his hand up, and then Dennis. Go ahead, Akif.
Hi, Rob. So back in the day, we used to do a lot of trips around the country. You and I, we would go to San Fran, and we went to Chicago, we went to a lot of places. And a lot of folks there hosted, and I think still have a relationship with Convergence. So I think if we could invite those folks to re-host, so they can see where 15 years later, or 10 years later, or 5 years later, Convergence has come through this book, it might really ignite a lot of momentum around the idea and support for Convergence. So I think you already have the groups in the country to go do a book tour with.
Great.
And then invite some local media and a really good social media person to broadcast it. You have a nice multiplier effect.
That's great.
Akif wants on the launch team.
Yeah, I think also, those of you who do have networks, you said you feel comfortable eventually putting word out about the book, that would be great. Who else? Dennis. Oh, Dennis. I
don't know if my name is on the launch team. Yeah.
Big fan.
Terrific.
We'll take it.
All right.
You need to get into prose and poetry.
Get what?
What is it?
Politics
and prose, that's what it's called.
All right, does anyone here have a connection to politics and prose?
Well, if
Let us
anybody,
know.
yeah, find somebody who does, because that's a
Great.
big thing in DC, right?
No, it's a big deal.
What did I say? Politics and poetry? I had the P's right.
Politics and postage? Any other ideas about things we can be doing, or you can be doing, or we all can be doing to try to take these ideas out into the world? Louise?
Hi, I'm James coming from More Like Us. I don't know if it's an idea for you, but I think many times in this field there's a tension between breadth and depth. So the question, what is the stop, drop, and roll that someone who may not buy the book or read it entirely should take away from it? So do you have a stop, drop, and roll? If a journalist said, what are the 3 things to know?
I'm going to have John work on that for me. No, seriously, when John was talking, I was like, I really got to work on my elevator pitch. I think that is something that we're aware of and we are working on. But we'll, in addition to us being able to say it in a stop, drop, and roll fashion, we have a website with resources, and as a part of our learning lab, we share the lessons in different formats too.
Rob and Mariah, first of all, congratulations. It's exciting. Oh, right. Sorry. Louise Vincent. Really honored to have been part of Rob's original board as a trustee. So I love the idea of wherever you are, of how we did all those early salons. I'll do one for sure. Also, we probably all have newsletters or things that we send out or organizations that you're involved in. And so we could put the book into, I will certainly put it in 2 of mine, one for Blink, which is all trauma oriented and medical, so that could be good. And then of course, Baltimore Mediations. But I'm also just thinking of really echoing what everyone has said today, and just the power of each of our relational influence on just those whom we know. And these books can really be valuable for holiday presents, Christmas presents, Hanukkah presents, etc. And I know that's coming out in July, but that's a good time, and we want to get lots of people buying so it can become a bestseller, because it will be. And that is how it works, those algorithms, we know that. And I do think with politics and prose, I know that it's a big deal, but it was easy for us. I think if you just introduced yourself and said you had this book and you'd be willing to come as the author, you'll be in like that.
We're actually gonna, we need to transition now into some of our closing remarks. So Rob will be here during the cocktail hour, and we'll be reaching out to all of you and appreciate in advance your support and ideas around the book. So thank you, Rob. And with that, I'd like to invite up our board chair. Our board chair, Art Taylor, who's going to help me with some closing remarks. Or maybe he's speaking from back there.
Hello. I'll just stand back here. I'm going to be really brief. I really love the question that we were asked to address earlier today about hopefulness. Because I'm generally a hopeful person. And I am that way because it doesn't really help to be hopeless. And I think hopefulness is somewhat of a state of mind. But there are opportunities, I think, for us to be hopeful about some things. There are opportunities for us to animate our hope through an activity or through an engagement. And I believe what we heard today here in this institution is one of those things. My story with Convergence goes back about 7 years when someone asked me to attend a Convergence Leadership Council meeting. I didn't even know what Convergence was. I had no idea that it existed. And so when I came to the meeting and saw so many people committed to this idea of communicating, working across difference to solve problems, I was really moved by it. And today, as chair of this board, I continue to be moved. And I'm really hopeful that many of you who are new to Convergence, who are coming to us for the first time, as I did 7 years ago, will find a way to animate your hopefulness through this organization. And all of you who've been with us for 15 years or less will continue to find ways to animate your hopefulness through Convergence. I want to make it very clear that this is not easy work. Our board really leans into it. We know that there are those of you who've committed yourselves to it, and the work is difficult. But I'll tell you something, it gets easier when you engage with us. We need you. We need your time. As someone mentioned, maybe we can do some salons. We need your interests. Some of you might even be on panels. We need you to spread the word to others. Some of you can be, in the word of the preachers, the evangelists of this work. We need you because you make this work easier. And finally, I'll say, we need your money. We need your money. Because this can't happen without it. This isn't simply a movement. It's an institution. And institutions are organizations that bring people and ideas together. But what holds it all together is money. And so, for those of you who've given, I'm asking you to give more. And for those of you who haven't given yet, I'm asking you to think about what you can give. And for those of you who need us to answer more questions about why we're here, reach out to us. And I can assure you, if we don't hear from you, you will hear from us. So that's my closing remark today. And I want to turn it back over to Mariah. And finally, just thank all of you for coming today. We really enjoyed you. Thank you.
I think that we, all of us in this room, are a part of countering the dominant narrative that we're hopelessly divided, that the other side is beyond reproach, that life is a zero-sum game, and we might as well cling to our identity groups, give up on solving our shared problems, and all go home. I think that the work that we do together demonstrates that it's not only possible, but it's probable. As I said, I've been so honored to do this work my whole career, and I can't think of a time when I didn't feel like folks made progress. That it's not only possible, but probable for folks of widely differing points of view to uncover their hidden values and goals and to forge wise and durable solutions to seemingly intractable issues. I can't imagine anything that might resonate more right now, and it's certainly the thing that I love getting to dedicate my life to. So really a very genuine thank you from me personally, but I know also from all of our staff and board to all of the ways that all of you in the room make this possible. It is really a joy to be able to work with all of you, our board, our leadership council members, our new friends, and our staff. So many of you shared really important, helpful ideas today. Please keep them coming. Please continue to be in conversation with us and collaborating with us. And for those of you who are new to us today, we're so glad that you are here. We hope you'll consider joining our leadership council and becoming champions of this work. You can talk to any of the staff in the room about what that looks like. And as Art said, if you're able, or I think as Art said, even if you're not able, I don't know, if you're able to contribute financially, that is very helpful to us being able to be here to do this important work. So we are so grateful to all of you and looking forward to some time now to celebrate 15 years of Convergence and Jeff Weisbass's birthday. Thank you again for being here today, for being a part of our community, and please join us in some celebration.